Okay, good morning, everyone. Thank you for taking the opportunity to join us today for the Somerset Council's Scrutiny Committee for Children and Families. Here we are in Taunton. Thank you for those of you, the members that have joined us, etc. And thank you for the officers that have joined us. So before we speak, can I check that everyone is able to hear? We've done the sound check, so that's ticked off. Just to remind you all that agenda pack with papers are published on ModGov these days, although there are some paper copies available. And if you got to ask members or officers when you speak to a specific item or page, could you make reference to that page either in the main papers or the supplementary packs? Supplementary agenda packs were published on the 6th and 7th of March. Could I ask everyone to speak clearly and state your name for the benefit of anybody that's listening online when you speak? Obviously, welcome to any members of the public or press that have joined us. I don't think there are. The meeting is being recorded by the council for our own reference. And finally, as the agenda packs, we've done that one. So for the housekeeping, there are no expected fire alarms, but should this happen, please follow Democratic Services colleagues and they will lead you the way out to the car park at the rear of the building. Okay, that's those bits done. So item 1 of our agenda is apologies for absence, please.
Thank you, Chair. Good morning, committee. We've received apologies from Councillor Snell, for whom Councillor Hobhouse is substituting. We've also received apologies from one of our co-opted members, Ruth Hobbs, and Councillor Clayton is online, Chair.
Thank you. Are there any other apologies for absence?
Sorry, just to clarify, Chair, as well, obviously, Lead Director, Executive Director Claire Winter has just messaged, so she's not feeling 100%, so she is also joining online.
Sorry, you're not feeling well, Claire. Thank you for taking the time to join us online. Okay, item 2, declarations of interest. Members are asked to declare any items that are prevalent in today's agenda that aren't already declared. That's what I like. Silence. Moving on. Item 3 of our agenda is minutes of the last meeting. They were circulated. Could we just, members, are you happy to confirm that they're accurate? I wasn't there. Thank you. And we've got proposed and seconded. So any objections? Do we accept those? Thank you. Public question times. There aren't any that I'm aware of. No, that's fine. Item 5 of our agenda. Here we go then. So the main body today. So we're looking at this Children and Families Scrutiny Work Programme. I'm just conscious for those that are the observant among you will notice that our next meeting at the moment is programmed for May. Which is a jump. I'm not saying that we need one in April, but obviously the opportunity was there, and also Jamie has asked me to highlight the fact that we're circulating proposed dates over the next few weeks for next year's meetings, so we'll have the conversation about that. Jamie, is there anything you want to add in relation to?
Not at the moment, Chair. No, as you stated, there's no current scheduled meeting for April. And ultimately, it's down to the committee to decide whether they're comfortable.
Thank you. Members, so in relation to what we would cover next. So there are some items in the agenda in the papers that indicate for the meeting on the 15th of May. I'm just conscious that the Vice Chair and myself haven't had the opportunity to sit down with Jamie and Fiona, our clerk and manager, in relation to us planning our next year. So one of the things I'm going to suggest that we do is, Jamie, in the next couple of weeks, could we find an hour to sit down with you and Fiona just to have a look at where we are for next year, because there are a number of items on the plan that we want to do, and obviously that will help tie up with officers what the expectations are, particularly in relation to the Children's Services Transformation Plan. I think that we've got an item at the end of the agenda where we're having an update from the wonderful volunteers that are digging into that. But I think potentially, because of the importance of that meeting, one of the things I was going to suggest, members, is that we may want to consider at a future early in the next year of having a single item agenda, which is the transformation programme, which to allow us to look at all of the areas and drill down a little bit more into those. I think that will give the members of this committee that are getting a better understanding of the areas a chance to dig a little bit deeper, but also give us a chance to, as a committee, to have a look at it and see where we're going in relation to that. Francis, were you looking to say? Okay, so one of the problems we have, because before we start swapping, so one of the things, so right, pause the meeting for a second. Let's do the IT support. It might be helpful if you press the buttons in front of you for a second, just once. What that'll do, that'll sync it with the machine. It'll say, okay, just turn it on and off, and we're ready to go. Because the other problem we have is that the reason I'm doing that now is because when you press the button, what should happen is the cameras should move to you. So if you start swapping the mics around, it tends to, the camera talks to where it thinks that particular mic is. So that was why I so perhaps.
Well, when it's appropriate time to say, I absolutely agree about the transformation programme, but my point was, is there something else that you, your vice chair and officers can consider, which is making sure we get answers to the questions that we raise. Bearing in mind that, as you know, I emailed you last night, still haven't had an answer to a question that was raised 2 meetings ago.
Okay, thank you. So in relation to your email to me last night, what I'll do is I'll make sure when I get the first, I haven't had a chance to go through them all yet. So what I'll do, I'll forward that to officers to get a response to that, and we'll get that added as a after note to this meeting to show that it's been dealt with. And Steph, if you could just make a note to double chase me on that.
But the general case is about
wherever
questions.
I know that wherever possible, that's why we have the outcome tracker, is to try and do it. But what I would also suggest members, obviously subs, this is different for members of the committee, it's important that you look at the outcome tracker as well to make sure that the items that you want specifically dealt with came back through, because obviously the vice chair and myself, although we are diligent in trying to keep up with things, you are all members, our eyes and ears. So it's up to you to remind me what I've forgotten about. I'm not afraid to admit the fact that I do forget things. So we'll pick that up, Francis, and we'll do that. And as I say, so my suggestion is that the vice chair and myself, meet with our officers to go through it so that we can then start working up a plan for the next year. I don't think there are any objections to that. Okay, so that being said, I'm just conscious we've also got lots on the agenda today. So that's item 5. Any other points that members wanted to raise in relation to that? Okay, so we're moving on then. Item 6 of our agenda is the first of our substantive items. I'd like to welcome the presenters today. So thank you for taking the time to come along. I do believe the presenters will be managing the slides themselves. Is that correct? So good luck for that one. So everything is crossed for you. I'd like to welcome Steph and I'd like to welcome Patsy, and just to make sure that if you'd like to introduce your colleagues to us, that would be really good. Members, just to remind you all, this is something that we've asked to come to us. That the item is to focus on Somerset system-wide support for children and young people who self-injure. And it's important that we, obviously, when we get to, what I will ask is obviously let the presenters finish their presentation. If you have any questions during, please indicate, and I'll make it, the vice chair and myself will keep a note, and then we'll take questions afterwards. Patsy, thank you.
Thank you for welcoming us back. This is to provide an update from the presentation that we gave last June to Scrutiny in relation to children and young people's mental health and a system response. So I've brought along my colleagues today that work with us across the Somerset system to provide support for children and young people who self-injure. I'm going to go to my right first to introduce Claudine.
Lovely to see you all. Claudine Brown, I'm the head of CAMS and paediatric services in Somerset.
I'm Patsy Temple. I'm one of the consultants in public health. I work in the public health team at Somerset Council.
Good morning, Nick Harwood, Chief Executive Young Somerset.
And I'm Tracy Robinson, team leader from the Jigsaw project at Young Somerset.
We're going to start with a bit of a definition because there's often not a consensus around self-injury, and there are lots of different ways of defining it. We wanted to give you a bit of a sense of how we understand it as a system. There's quite a good news story behind us sitting here today. One of the things I'm really proud of is that we have a very, very joined up way of working in Somerset. When I work with colleagues in other areas, other heads of service, that is not what they report. That's not where they feel they are as a system. And actually, we've put a lot of work in coming together across social care, across public health, across the voluntary sector to try and find shared understandings and ways of working together. And I think that has been really effective. So I just wouldn't want to lose that. These are really challenging problems, but actually there's a good news story behind the way we actually have come together to work. So The definition that we're using today is self-injury is when someone intentionally injures their body in response to painful feelings or overwhelming situations and experiences. Self-injury is an expression of very real personal distress, but not necessarily an indicator of clinical mental illness. And one of the reasons we've included that is historically there has been a tendency to think this young person is mentally ill, they just need therapy, they just need medication. And actually we miss the kind of wider issues that affect young people. When we work together in a more holistic way, we can identify the cause of self-injury for a young person, and that may well be safeguarding issues, that may well be issues in their environment, it may well be within school, but having a siloed approach to self-injury and seeing that as something that simply is an indicator of mental illness that just needs to be treated doesn't produce the outcomes we want for young people. So we just wanted to set the tone of that and explain that that's the way we understand it and are working together.
Thank you. So I think this is the data that most people are familiar with. And what does it tell us? We know that Somerset appears near the top of the list for hospital admissions for self-harm in 10 to 24-year-olds. But we know that there is a downward trend, and there has been since there was a peak when Somerset was the highest in the southwest in 2018. And the data for 22-23, which was released last week, so post putting the presentation together, indicates that we are still on that downward trend and a decreasing trend, whereas other areas are remaining pretty stable at the rates that they are at. And this is hospital episode statistics. So this data only captures those individuals who present to hospital with having self-injured themselves and require some medical attention. It doesn't capture what we anecdotally hear a lot about, which is the community self-harm that we might be seeing. I have tried to include, just added in here that from the 22-23 data release, although it's not much, we'll see that Somerset is one of several who are on a very downward trend, but we've also, if you like, moved slightly down the rankings, if you like, of how they put that. So what we are doing is starting to come through and show in the data that has been persistently high over time. But alongside this, whilst hospital episode statistics at population level tell us one part of the story, we're keen to capture the voice of children and young people and their experiences in Somerset, and triangulate this data with that high level indicators that are published. And we have done this through the Somerset Health Schools Health and Wellbeing Survey that we have done in 2023 and in 2021, and we will be doing again this coming year in 2025. And we're starting to see that whilst that figure of 12% of year 10s who self-harm when worried seems high and is alarming for us to see, the responses are similar. So we're not seeing that increasing, but also it's similar to other areas comparing those questions, so such as Gloucestershire. We've also used the youth forum, the feedback from the youth forum that was held in October 2023, where they were asking a focus group of young people about why people in Somerset self-harm and do they have access to the right support. So using very much that voice of young people to triangulate. And on the back of this information, we have this year put in place a Children and Young People Engagement project, which will be starting in the spring, called Help My Friend Has Told Me, which is around responding to that peer support that individuals in schools are providing for their friends and being able to support those individuals to know where to go to help support those that they are disclosing. I'll hand over to Claudine, who will go through some of the improvements that we've had within services recently.
You'll be pleased to, I'm not going to talk through this slide in detail, but we wanted to capture it because it is again, it's back to that positive news story about the developments in services. When I started working in CAM services, I had a background in adult mental health and then moved into CAM services. One of the things that was really shocking to me in the first few months I was working in the service was people would come up to me in car parks and anywhere really, corridors, and tell me how terrible children's mental health services were. And I'm not a defensive person. I'm quite happy to listen and understand why people felt that, but it was really shocking, the strength of feeling. I'd never experienced it about anything else. And I think it was it was very true that the level of investment and the recognition of the investment that children's mental health services needed was well behind where it needed to be. And objectively, my experience was that actually the services were too small to do what we needed them to do. They hadn't modernised enough, and there just hadn't been a recognition, which is surprising because there was a lot of national conversation about it, but there just hadn't been a recognition of the level of investment that was needed. I would say we were in a very positive position in Somerset in that we lobbied very hard. We worked together as a multi-agency system, and we've seen a lot of investment in health services over the last 5 or 6 years. And that particularly addresses self-injury. So if we went back 6 or 7 years ago, we would have one poor nurse probably based at the hospital dealing with all of the assessments that came through in relation to self-injury. It was overwhelming and impossible, and there was never any opportunity to do proper quality follow-up or to engage with families. We now have a fully staffed CAMHS liaison services that work in the hospital will see young people from the moment they are medically fit, and sometimes even before. So the emergency department staff will contact and work closely with those staff so that we can do an assessment as quickly as possible. But I just want to, just highlight some of the other preventative areas as well. So our mental health support teams, which are now based in school settings, are picking up young people at a much earlier stage. And in addition to that, we've developed, which Nick will be coming to later, we've developed the work that we do with the voluntary sector so that young people who come into the hospital setting are properly followed up. There's an opportunity to look at that ongoing harm reduction. We don't see it as a single episode. And I will just mention the level of training that I think the whole system has been really high quality training for all our staff. I think back 6, 7, 8 years ago, very few staff felt really confident working with self-injury. I think that's a very different picture now. So if we think about the start of the pathway, this is an unusual situation in that for most other health conditions, we work really hard to try to prevent young people ending up at an emergency department. This is one of those rare occasions where if self-injury had occurred, medical assessment is probably needed, and we can't skip that bit. We can't remove that from part of the pathway. But prior to that, young people who may self-injure more superficially will be seeking help through probably friends and family. We know from what we hear that young people will often go to their peers for support. In some cases, that self-harm, may be happening for some time, maybe happening in secret before anybody's aware of it. So again, as part of our conversations as a multi-agency system, it's about thinking about how do we put support in the right place for those young people when those issues are beginning to develop. I think we can move on. Yeah. So the start of the pathway is young people seeking help from wherever they may choose to seek that. For most young people, we will first become aware of them when they arrive at our emergency department. The most common forms of self-injury continue to be cutting or overdosing. They will pretty much in all cases require medical intervention. So we have to work closely in partnership with our medical colleagues in the emergency department. That, I will say, has been a challenge because that's been a big journey of education for our medical colleagues who are working in a highly pressured, high turnover environment, who don't always have the bandwidth and the time and space for completely understanding the circumstances young people are coming into. So our CAMHS liaison colleagues worked really hard alongside our doctors and our nurses working in emergency department to help them understand the circumstances of those young people and ensure that they get quality assessment. We can talk a bit through what we know. We have seen a reduction in the number of assessments year on year. This is quite early. I wouldn't want to overstate this, but this is a positive in Somerset. That isn't necessarily something that's occurring all over the country, but we have seen there was a pretty sustained attendance to emergency departments throughout COVID, which I don't think anybody would be surprised by. It was one of the primary sources of accessing support for young people at that time. But actually, instead of continuing to rise, we've actually started to see that small decrease. The number of young people requiring 2 or more assessments in the same year is also starting to slightly decrease. One of the things that has always been a big challenge for us is that there's a percentage, and it's a relatively small percentage, of young people who are repeat attenders to our emergency department, and they make up a really significant proportion of the numbers. So we have a number of mechanisms for trying to identify, follow up and support those young people. Nick will talk a little bit about that a bit more in a minute, but we also have high intensity user groups, which are attended by senior doctors from our emergency department, from our ambulance service, and we have police representation as well. And they will do high intensity plans with those young people so that we have a proper multi-agency package of care. I think probably just the couple of last bits to pick out on that slide. Again, I think a great credit to the multi-agency work we've done around Homes and Horizons. The number of young people in care, looked after children that we're seeing has started to reduce. We very much hoped that would happen, and we are starting to see that trend. There is a slight increase in first-time presentations. That's something we need to understand and work together a little bit more on. And I think our concern from the last couple of years has just been starting to see a slightly higher number of younger children coming in. That's not with such severe self-injury, but they are attending, and that's their gateway coming in, which is a bit of a concern and something we need to work on. A little bit of information about gender and age split. It is what we haven't seen a significant change in those trends. It is usually predominantly young females that we see through the emergency department. We aren't complacent about that. We accept that the needs of young lads often gets missed in that, and there may be different types of self-injury. And again, I'm sure Nick will mention this. We often try and factor that in. Just because it's young girls that we will see via self-injury in the emergency department doesn't mean we don't recognise that there's a wider pool of need that we have to reach in different ways.
Thank you. I'll give a bit of background to the Jigsaw project if I can, just to say that to give the evidence basis for this work. Every winter, the NHS nationally, I'll give you a bit of background to the Jigsaw project for context and demonstrate its evidence base and why it's so efficient and efficacious as it is. NHS England every year releases winter diversion money, which is literally designed to keep people away from hospital, an element of which is targeted at children and young people because of the additional pressures on EDs over the winter period. A few years ago, we had the notion, working in partnership and a really trusted and embedded relationship between Young Somerset and CAMHS and the wider system colleagues, about what could be the value of a non-clinical support mechanism to divert young people away from going into emergency departments and staying there and being admitted to wards as well. So we pitched an idea about this work, a diversion away, and demonstrated quite quickly the value of a youth worker alongside clinical professionals, and picking up that notion of where we started with not every presentation of self-injury is an indication of clinical mental illness, but is distressful for that young person. So having a non-agendered, non-clinical professional who was there to listen to the young person and offer a different voice into the mix around clinicians proved really, really effective, encouraging young people and their families to have the confidence to deal with what was going on in a non-clinical way once the medical attention had been done. So Jigsaw came from that, and I'm really pleased that the value of the system demonstrated itself so quickly that the ICB very quickly embedded this into base budget. So Jigsaw is no longer really a project, it's a service. Projects have a start, a middle and an end, don't they? This is now part of the system response to self-injury for young people across the county, and we're hoping, of course, that extends into the permanent long term. The youth work approach is about presenting and offering to the young person in this moment of distress as quickly as possible, and led by CAMHS colleagues here, that to the timing of that, offering that positive adult who will listen really well and help that young person navigate to where they want to get to, in terms of what Claudine and Patsy have said, that holistic approach to this, because whilst this is medical presentation, of course, there are wider impacts that have brought the young person to this point of distress, such as they self-injure. I won't talk you through the methodology there, just to say that that is now a core and integral part of the pathway that is understood in our acute hospitals, and we've taken time to test it, to revise it, review it actively, both with at practitioner level and also at senior level, to make sure there's eyes on a process that can be as efficient and effective for that young person and their family as quickly and safely as possible. Thanks, Patsy. Again, there's data here which does show how effective this approach, this additional resource into an established system, and as Claudine said, has had additional investment over the years. Jigsaw, alongside that, is proving to be an enabler and an accelerator of those outcomes, and not just in the shorter term. What we're able to demonstrate is that by applying this resource and methodology in a very tightly integrated and safe way, we can not only accelerate outcomes for that young person in terms of getting them out of hospital as quickly as possible, because we know that is the best route for them and their families and their communities, but in a way that is sustainable. And that's incredibly important. What the process does, alongside clinical input and medical input, is provide the young person with strategies to be able to cope with the situation that they're dealing with. And so you'll see it's quite intense, high intensity over a short period of time. 12 weeks is not a long time in the life of a young person, but it's enough time to provide some stability. And again, that constant engagement with clinical colleagues, making sure that that is safe and that pathway is understood and that child and young person feels empowered within that to take control of their situation. And then what our staff do is broker and signpost additional community-based services to sustain those outcomes. So it's not a young Somerset dependency model or anything like that. What it's about is our staff looking at Billy in whatever community Billy is in, and making contact with trusted providers in that locality that we can then introduce Billy to if Billy's not been going to the youth club, or maybe there's a different level of support. And what does it look like for the family as well? Because parental confidence around this issue can be incredibly low. It can be incredibly difficult for parents to understand why their 13-year-old daughter is suddenly cutting her arm. What does that mean for that family? What is the wider dynamic? So there's a contextual element to this as well that's really important in terms of, as I said, both enabling, accelerating and sustaining those outcomes. So I'm really pleased to be able to share a kind of high-level précis of Jigsaw. And I'll pass on to Tracy, who's a team leader, who's going to give you a case study sort of summary really of what it looks like for boots on the ground, the staff that are doing this work day in, day out.
Hello. So yes, I was asked to bring you a case study, and our work really varies a lot because we do tailor it to each individual. So I've chosen one that is a fairly typical example. So Poppy was 15. She was referred after presenting to Yeovil, to YDH, having taken 2 overdoses of paracetamol and ibuprofen. She also engaged in self-injury, so cutting to her arm and sometimes to her legs. There was anxiety around school and very poor attendance. She did go into school, but she found it very difficult to attend lessons. She would often be found crying in the toilet or cutting herself, and would often have to be sent home because the school felt that they couldn't keep her safe. There was also problems with the relationships at home. So there was problems between mum and dad's relationship, and Poppy and her mum had caught the father having an affair, so this had impacted on the relationship between Poppy and her dad. She was devastated, felt that dad blamed her and was punishing her, and she felt very cut off from dad. She felt he didn't like her anymore. So the first thing that we do is we go and meet the family, and we introduce ourselves as a worker to young person and whoever their parent or carer may be at home. We explain the service and we get consent from the parent or carer, and we start work. So we can either meet them in school or at home, depending on their circumstances. So Poppy wanted me to meet her in school because she really liked the idea that I could take her out to her happy place, which was Costa. And it was another reason not to be in school, but it was a positive reason. At first, she barely spoke to me, very, very quiet. So I got out my youth work toolkit and we did colouring, doodling. We went and visited pet shops. There's one really great pet shop in Yeovil that we used to spend quite a lot of time in. And we'd play games, go for walks, just anything to sort of focus on the relationship building before we could really begin to do any work.
She had very low self-esteem, very low self-image, thought she was very ugly and unattractive. So once we'd start to establish the relationship, we would talk about the reasons, you know, what was going on for Poppy, the reasons behind perhaps the self-injury and the distress and the low self-esteem. And she told me that she didn't actually want to die when she'd taken the overdose. She'd felt that it was her only option at that time. Things had got so awful for her, her life became unmanageable. And the message was that she wanted to give was that she wanted Dad to love her again. And she felt she was being punished at school and at home, and that nobody was listening to her. They weren't taking her problems seriously. They would try and cheer her up, distract her, just tell her everything was going to be okay. And she felt that this wasn't addressing the problem. So her intention was to express her pain to the world. So quite early on, we set some goals together, and this is a really important part of what we do. We need a focus for our work because we have a very short time. So she chose that she wanted to attend more lessons because she was in year 11, had GCSEs coming up. She wanted to learn to manage her emotions in a more, you know, in a more positive way. And she wanted to improve her relationship with Dad. So addressing the school issues, I started meeting with school and parents and Poppy all together. Poppy and I would meet beforehand, and I would find out what the issues were, and then we'd go back to school and talk about the sensory issues she was having, which made the classroom be overwhelming, problems with certain teachers or certain students. And school were really helpful. They made some changes to the lessons, and we arranged some one-to-one meetings with a couple of teachers to try and reduce how intimidated she felt when entering the classroom. And Mum actually offered some rewards for improved attendance, so getting their nails done together or going shopping, some mum and daughter time. And ongoing between Poppy and I, we worked on her emotional intelligence, and you know, working with asking questions and doing lots of artwork, you know, mapping things out on paper. You know, what were the feelings she was having? You know, where were they in her body? What did they feel like? What were they trying to say? Identify those feelings. None of these skills she possessed to begin with. She experienced feelings almost like a thought, rather than something that existed within her physical body. And that was really interesting to me. And sorry, getting tongue-tied. We explored how her feelings were trying to communicate with her, and how that would help her then communicate with others and express her feelings. And when it came to Dad, at first, she didn't want to address that directly with Dad. But after a few sessions, she had the courage, and we met with Dad for a joint session. And he responded brilliantly, and they had a lovely conversation. There was some tears, but it was a really positive experience, and their relationship really improved after that. And communication with the whole family started to improve. She would tell me about conversations they'd had, you know, over the breakfast table or while they were watching TV in the evening. They'd started to talk about feelings in their family where they hadn't before. The incidences of self-injury began to reduce. So she would tell me, oh, I haven't self-harmed this week. I haven't self-harmed for 2 weeks or 3 weeks. There were no further admissions to the hospital while I was working with her. Her school attendance improved gradually. It was a slow process. And her relationship with Dad continued to improve. And as our relationship came to an end, so, you know, after our 12 weeks or so, I was able to refer her for some longer term support to We've Got This. So we supply a worker from Young Somerset to We've Got This, which is run by the Open Mental Health Service. And I also referred the family to Yeovil for Family. And they were going to work on, you know, family dynamics, family relationships. And she worked with We've Got This for about a year, during which time she did pass her exams and got good qualifications enough to go to college. And the We've Got This worker was able to support her during that transition to college and through a breakup with her boyfriend. And I was really pleased to hear that during that time, the self-harm didn't reappear and there were no admissions to hospital. And so, yeah, I hope that shows you a little bit of insight, just a brief overview of the work we do with the young person and how it's really about listening, allowing them to have their voice heard, advocating for them, and yeah, supporting them to communicate and to make positive changes in their lives.
Thank you.
I think I might just sneak the point in here just because I want to, that actually there are parts of the country where young people are popped onto waiting lists and they'll wait for 6 months for somebody to see them to assess something that happened months before. We're really proud of the fact that actually young people in Somerset are seen in a really timely way and they're followed up really appropriately with someone with the right skills, which is you can then see the difference in that outcome rather than someone stuck with something that they're not making any progress with and then have such high expectations of what a mental health service can deliver at the end of that. So it's a really good example of the right fit and the right work, I think.
And at the right time. But I ask a tiny extra question. What does timely mean?
Oh wow, that's it's a complex question, but I think I would say it has to be able to meet that young person's need effectively in the shortest time possible. So yeah, if you mean how long, that would have been days, I would think, between.
Yeah, usually the
Yeah.
communication between CAMHS liaison and Young Somerset is in about as real time as you can get when it's safe and appropriate to do so. And the clinician will lead that and make that decision when to phone us. And then we will deploy that resource as quickly as is humanly possible. On occasions, it has been the same day. Usually it's certainly within a couple of days or so, Francis, yeah.
Members, if we could just give them a chance to finish the presentation, only because we're going to start getting behind time already, and I've asked that we can be concise because I want to make sure we get everything in today. Thank you.
So we've just got a few more slides. I think at the beginning we looked at the data, which was very much the hospital episode. So those who present to hospital with self-harm, we know that it's difficult to capture data on the amount of self-harm, self-injury that happens in the community that doesn't actually require individuals to go to seek medical attention. And we're working with a national expert on that from the self-harm project in Manchester to look at how we could start to collect some of that information locally through school nursing, through safeguarding leads in schools and mental health support teams to kind of get a better picture of that. Because if we go on now to talk about what general emotional health and wellbeing support there is for schools and for school-aged children, we have in Somerset, and we spoke quite eloquently about this before in our previous presentation in June, we've got mental health support teams that the ICB commissioned. There are children's wellbeing practitioners, which is delivered through Young Somerset, who provide quite a similar service to support those in the community. We have mental health, senior mental health leads through schools, with training is provided for, but DFE will fund. That is an individual who works within a school who takes on an additional role, take a senior mental health lead role within that school, and to implement a whole school approach to emotional health and wellbeing. There's online counselling and apps and young minds to support those who might look to seek for some lower general support for emotional health and wellbeing. And we have a training offer that's around staff in schools for their continued professional development, but also for their RSHE and PSHE curriculum delivery. And a lot of this is delivered across the system, but we have the Children and Young People website and the Mental Health Toolkit, and there's an access portal for professionals, for families, for school staff to access what is available and where they might start to look for that. We've talked about mental health support teams before, but just wanted to indicate that there is a range across that. So through the council, there's the Education Psychology Service, which provides some CPD training for practitioners in the mental health senior mental health leads and the mental health leads in schools. Public health also support with elements of that training. We have the Somerset Foundation Trust, so the CAMS piece in the middle, and with Young Somerset, we've got the mental health and wellbeing service. So that helps to deliver that whole piece around mental health support teams, and the education mental health practitioners, so those that work within schools, but also those that work within the community, supported by embedding that whole school approach and the whole school approach practitioners, which sit within CAMS as well. So it's quite a complex way of working across the whole system to support that. And we have a training offer that comes through from within public health, and one of the biggest growth areas that we've had over the last couple of years has been self-harm awareness training, which we've had and commissioned to be delivered by Harmless, and I know that CAMS have also had their own training developed and delivered, and this is very much for individuals who self-harm, but also for their carers and parents to understand the context of self-harm and why they might be self-harming. We've delivered specific ones for education system leaders and school specific staff to equip them with some of with a deeper understanding of the context of self-harm and why that might be happening, how they can support that. Have mental health first aid for youth, which is how to recognise some of those crucial signs of mental ill health. And there's also a whole a variety of training available just for the community and for others to access through our mental health training offer on Healthy Somerset. But as a piece of, just wanted to cover one last piece, which was around the system and strategic work that we are doing. So self-harm has been set as a priority for the ICS, so the Integrated Care System Children and Families Partnership Board. This was set in the autumn. And within that, we've put two areas of focus. One is around the A&E and admissions, which is the first bit of the presentation that we've spoken to today. And the second area of focus is development of what support is available to schools and settings. There's a task and finish group was established and started and met in January. And through that, we've linked up with national lead for self-harm. We've linked in with the clinical lead for NHSE. So NHS England clinical lead for self-harm in the local system to support us understanding our data, but also better understanding what the mechanisms are and the work that is being done across the country. We've linked in with OHID, which is the Office for Health Inequalities and Disparities, who have developed a Southwest tool to look at the not only the data, the evidence base of interventions, but also bringing all of that together in case studies and linking in with those others in our region who are similarly looking at how they can improve services and the outcomes for children and young people around self-harm. And the last bit being that they OHID are putting on a regional self-harm conference here in Taunton in April, which is predominantly to look at how we work together across the system. And they started to share, we've been involved in the development of what that might look like, and actually most of the speakers are those who we have already linked in with in Somerset, that they are bringing down to help join up some of that work across the whole of the region. So I hope we've given you a bit of an overview of where we are on the topic of self-injury.
I've been here for a number of years now, and I don't want to put words into Councillor Nicholson's head, but to hear the progress and the change over those years, for me, it's heartening to know that we're helping those young people better. Because you were right, when we first started having this conversation, it was not a nice place for young people to have mental health issues, and to hear where you've got to now, to me, is heartening, and the fact that it seems to be getting better, but also to hear when you say that you're not taking it for granted just yet. We need to keep it up. That's the important thing. So for me personally, that is really heartening. So thank you for that. I will take some questions, but come back to it. John Hunt, did you want to come in first?
Oh, here we go. Is that working? It is. I don't know how long I've been in the Scrutiny Committee, but it's several years now, and that is by far and away the best presentation I've ever seen. And Tracy, your work, oh my goodness. I'm almost welling up hearing what you've had to say. I just find it extraordinary. You've talked about there's no need to, you've had good funding. You're happy with that. No, I haven't known that for a very long time either. But to hear you've got great funding, and any of the public watching now, which I doubt there's very many, but hopefully some will, and they will have heard your presentation and heard for probably for the first time for a very long time that there's real value for their money as well. But for the young people like Poppy, and particularly the mum and dad as well, actually, because that's very much a family thing, and all of their friends, all those kids at school are very much involved in that one case. That one case has probably affected hundreds of lives in various ways. And just very, very impressed. Not my questions, but I just wanted to say that before I say what I want to say. You mentioned earlier about Somerset's downward trend now. I was a little surprised. You mentioned COVID as well, that clearly that would change during COVID, but it's still going down after it, which I'm surprised. So my question is on that is, do we know why that is specifically? I know that's probably an impossible question to answer. The other, just an observation really, is there from life, as it were. Is there a degree of peer pressure? So is there like an area, do you have stats? Probably not, but so a particular school, a particular class where one child self-harms, other children perhaps follow suit. Occurs to me a good thing there. Well, not a good thing there, but a thing that may be happening. Perhaps I'll leave it at that to let others speak as well. But just to say again, very well done. Fantastic. Thank you.
If I can just start with a response just for contextualisation to say that the Jigsaw service that operates across both YDH and Musgrave Park Hospital, in terms of its efficacy and efficiency, John, it costs £135,000 for a year. So if you look at the impact that that work has for such a relatively tiny investment, I think the value speaks for itself. And shall I start just quickly on the peer one, because Claudine prompted me and I missed it in the presentation. That dynamic does exist. We know young people are tribal, and young people often want to feel that they belong somewhere. And it can be a feature of self-injury that actually that becomes there's a tribal dynamic to it. So there is that. Part of the workforce development across the wider piece, colleagues in care, education and health, is increasing that kind of lowest common denominator really of confidence to talk openly about these things. The same with suicide. It's something that we naturally instinctively recoil from when it's presented to us as a 13-year-old in distress. We don't necessarily know how to deal with that. So that system approach to training and support and good quality supervision for those that are at the sharp end of this is really important. And as you said, expanding that into a family sense of confidence to talk about it as well is really important. The other dynamic I will pick up is young men. We know that young men are not represented within the system in terms of accessing the services they might need for their own support. Self-injury in young men can look very different. Own my own gender here, and my own recollection of being a teenage boy is that we tend to go sometimes from 0 to 100 in the blink of an eye, and that can manifest itself in punching a wall or doing things, you know, in a physical way that is very different to an overdose and self-injury through cutting. So that we're aware of that. Youth work has been aware of that as a profession for the past 50, 60 years, and that's something we are cited on and want to actively reach out more. And again, I'm not just talking from a young Somerset perspective, but from a youth work sector in Somerset perspective. What is it that we can do to equip young men with a better vocabulary around feelings, a better sense of ownership of feelings? And actually, it's a really, really, really good thing to have those feelings and be able to talk about them. So we're aware of that, and we do know that there is the risk of missing, if you like, a trick in terms of that. We rely on, though, the impact of where we've supported young men for them to be our strongest advocates in terms of accessing system support, because actually that voice of a young man aged 13 or 14 at secondary school, because this is highly visible stuff at times and their peers will see it. And actually, if that young person is then equipped to a point where they can share their story confidently, that increases the confidence of others in maybe accessing those services. I hope that kind of addresses it.
Thank you.
I think just to pick up the point about, I'm really glad you noticed it, because we're not at all complacent about the progress. We're very glad of it. You know, we need the good stories. Things are tough, and particularly at the moment, you know, we are all aware, working in the public sector, that we're in, you know, really, really difficult times. I think we were you could say fortunate, but I'd like to say prescient in Somerset, that we actually recognised we needed to get ourselves in a better position when there was investment available. And I think we invested that in a very smart way across our agencies. So your question about why we're seeing a little bit of a decrease, I think it's because we have a genuinely joined up system. You could run a system that works at the hospital where you do an assessment, you make some recommendations, it's not connected to anything, nobody follows up, and the young person just comes back through in crisis. So you just see your little bit. I think the fact that we have thought about how does this work across all the agencies, if the issue is not, and there are some young people where that's, there are going to be some long-standing mental health issues. They may need specialist care for a long period of time. Others where we need a social care intervention. I think the relationships and the way we communicate is so much better that actually we're just much more effective. I also wouldn't want to be complacent that that's a relatively small drop. I think the reality of self-harm, self-injury is not going away anytime soon, and we're going to have to continue to understand and wrestle with that. And it's probably going to morph and change a little bit as the next generation comes through and expresses it differently.
Thank you for the response. Okay, members, I've got 3 members of the 2 in the room and 1 online that I to ask us. I'm sorry, I'm going to have to be a little bit strict on this because we've got a long agenda. You didn't get in early enough, members. We can take the questions outside of the meeting, but I'm going to stick with the ones because otherwise we're going to be about 20 minutes overrunning before we even get past the first main substantive item. I am sorry, put your hands up quicker next time. Okay, Martin Lovell, Councillor Lovell.
Thank you, Chair. So, thank you very much for the presentation. 2 questions. You talked about the referrals to A&E, and the people in A&E are stressed and not necessarily able to cope with the actual particular position. I've got a scenario of a self-harm arriving late on a Saturday night, early Sunday morning, the furthest possible you can be from a Friday afternoon and a Monday morning for normal services. What is the backup, out of hours backup service to make sure something is happening to provide the correct support? My second question is one big word not mentioned today, but why my thinking must be connected, but argue against me. I would have put suicide prevention along the same spectrum as what we've been talking about this morning. Is there a case for doing that, or well, are we talking about 2 completely different things and 2 completely different approaches to that? Thank you.
So we'll go backwards, I think. So I agree, they're totally connected. In some contexts, I think separating suicide prevention and self-injury is helpful. Other times, less so. I think in terms of how we work, we very much talk about suicide prevention. It's part of our kind of multi-agency approach. We don't always talk about it with young people in that way, because young people may just have a very specific low-level issue with a certain habit of self-injury. But yes, we absolutely see it in the context of good suicide prevention, which we're completely signed up for. Your question about overnight, and yes, there's always going to be a kind of moment. We don't yet, and on our list of things that we have to consider is that gap, overnight gap for young people who present at sort of 3 o'clock in the morning on a Sunday night. We currently don't have a liaison offer in the hospital during that time. The numbers are really small. They're really, really tiny. And the way we manage that safely at the moment is that we would admit young people to a paediatric ward for assessment first thing that morning. So we make it safe. We would not be turning a young person away at 3 o'clock in the morning and sending them home. So they would wait until, there were staff on shift the next morning. So it's a little bit of a gap. We need to decide, do we want staff available at 3 o'clock in the morning? We may at some point, but it is safely covered, to reassure you.
Thank you, Chair. Thank you for that. Andy Hadley, Councillor Hadley.
Thank you, Chair. First of all, Councillor John Hunt's comments regarding the Jigsaw project, exactly. It's a wonderful project, and I wish you all the best. Just one quick question. You mentioned you have to go, the first thing you did, you met the family, you had to get consent before you could then proceed. Do you get many families that refuse consent? And if you do, what happens then? How do you deal with that child? Or is that a very small occurrence?
Thanks, Eddie. I'll start and then I'll hand off to Tracy with what that looks like in a day-to-day context. For us, a youth work relationship is strong because it's voluntary. It's an offered relationship. So whilst by necessity, there's a medical and clinical response to presentation, Jigsaw is offered. So it's about describing what the work can do and can't do, and then the young person and their family making a choice around engagement with that, because it absolutely relies on them wanting to access that support and being ready for that. And part of that is about the timing and being led by the clinician when they pick up the phone to us, because they will have a sense of, yes, this child, this family is receptive to something else now. It sounds like they want the support. So we need to get that consent. On a day-to-day basis, I don't know how well that lands, but Tracy, I'm sure will be able to say how many families have turned us down recently.
Very few turn us down because of the way we work very closely with the CAMS liaison team, and they offer the service at that first instance and give a very clear explanation of what we do, and they would only put in a referral if there's consent at that point. Sometimes once we get in touch and talk to them occasionally, they change their minds, or perhaps in the moment in the hospital they were keen, but actually they've had time to think about it and decide no. But it's quite rare. They usually do. Not amazing. Yeah, they usually do work with us.
Thank you. Online, Councillor Bailey. John, are you there? Would you like to ask your question, sir?
Yes, thank you, Chair. And just I've been invited to join this group as part of the adult and health element. So thank you for that invitation. It's fascinating and very good and positive presentation. Only one point really. I could only see online the backs of the team's heads. So I don't know whether there's any way we can sort that for the future. I'm sure they've got faces as well. My point is really about when the county pulled out of youth services, it was required by volunteers to set up that support in their communities. And I was involved in that in 2010, 11 and 12 and subsequently, and still involved. And so volunteers, we have to raise the money and to actually use professional youth workers to support us. My question is, your presentation was really about the reactive side of people who present at hospital. Obviously, we're involved very much before that in a sort of a proactive way. And I just and this is because I'm not at the coal face. I just wanted to understand how that that situation would operate. We do support and fund the youth workers to have some time out outreach into both schools in the area, primary and secondary, and also into families when needed. But it's that sort of element sort of before they get to the stage of having to pitch up in A&E. Could you just give me a picture of that, please? Thank you.
Yes, we could do a whole presentation on this, but as NHS Trust and Young Somerset, we also run our mental health support teams, which are working much closer to that early intervention, detecting young people and offering interventions when problems are first starting to present before they require medical intervention.
And if I pick up on the sort of current state of play within the youth work sector in Somerset, it's a very, very mixed economy. As I'm sure you're aware, John, there are towns and parishes that are able to fund their youth club provision and therefore are using professionally qualified, largely actually ex-authority members of staff to run those very successfully across the county. And then there's the pure voluntary clubs, as you say. I think in terms of the links between the system and the grassroots and making sure there is sort of parity of access to support and training, that is being worked on. Somerset has a sort of fledgling but strongly emerging Somerset Youth Work Alliance that's been facilitated by some lottery funding, and Spark Somerset are the enabler of that. They've got a director called Tash Scully. Tash joins the weekly system mental health autism learning difficulties programme board that I sit on as well. So there's a clear flow between the strategic and the operational, and Tash and we both sit on that board, are making sure that the priorities that the ICB Children Families Partnership Board are setting, which includes self-injury, then flow into that system, the alliance system as well, and therefore the training becomes accessible to youth workers, whether they are professionally qualified or volunteers in village and town youth clubs. So we're trying to make sure that our system is as integrated as possible, whichever way you kind of look at it or carve it up.
Thank you. Thank you for thank you for the questions. First of all, I looked back over my words in my head and realised I may have sounded abrupt earlier, members, so I apologise for that. If I came over as cutting people off, it's just that I'm conscious that we've got a full agenda and I need to make sure we cover as much of it as possible. So, but I know I'm pretty certain, Patsy, if either of any of the members want to direct any questions to you by email, I'm sure that you'll be willing to respond to those. And so, thank you for that. I think, just in summary, I think the positive nature of the questions we have and the responses gives an indication of how far we've come as a service. I've made a note here about best practice. The Poppy example was a really good example of how, and we should be singing from the hills that we're in a different place, and so that we can hopefully other people around the country can learn from us in the same way as we've been learning from them. So the suggestion for best practice. John reminded me of something that I forgot to do at the beginning. We opened the invite for this particular item to members from the Adults and Health Scrutiny Committee. So forgive me, members, if you've joined us that I didn't mention you at the start of that. So thank you for taking the time. It is important that we do wherever possible join up the elements. I think that the good work you've done has already been recognised by being adopted. So Jigsaw is coming into that, and I can only wish you well for the future, because every success story, it's not perfect. I'm a realist. We know where we are, but every success story that you are able to demonstrate is one less issue for further down the line. But as you say, you can never prove how much it's cost for something you don't know. So that's the hardest part. But early intervention for these young people hopefully will mean that they go on to have a better life. So thank you very much for your time, members. Thank you very much for your part in this, for what we have. Thank you. I'll look to move on now. So that was item 6 of our agenda, and I'm looking now to move on to item 7 of our agenda. Christian, I think we're going to talk about the budget monitoring. If you could be as concise as you can, that would help us gain some time for a little bit later, because I know we're covering some of the points in a bit, but if you'd like to introduce yourself and do your presentation. Thank you.
Thank you, Chair. You okay if we carry on sitting here rather than come to the front? Just think of the time. So yeah, Chris Evans, Head of Finance Business Partnering. I'll keep it as concise as possible. So there is some slides, hopefully, which should come on shortly. I'll start anyway. So this is the month 10 position for budget monitoring. So as of the end of January, the budget is 121.6 million for children this year. We're currently reporting a 14.9 million pounds overspend, which is 12.3% of the budget. However, the good news, if you can call it that, is that there is a 400,000 pounds favourable variance from month 9. That's mainly due to.
Chris, if you just pause for a second.
Sorry.
If you just pause for a second, we're having some technical issues. I think we were asking presenters to share the slides so they can manage their own slides. That's the first one. The second one is we're trying to get the camera to. That's my camera you just stolen. So let me turn my mic off and it'll.
I can move to the front if it's easier. Right. Okay.
Members online, sorry for that. I just wanted to make sure that we were. Just to advise members online that the cameras from that we're using are newly placed, and we haven't figured out yet. We're the third camera to look at the presenters, so I'm afraid you're probably going to have the back of Chris's head, but at least you can see who's talking rather than not.
Hopefully one of my colleagues is going to. Yeah, so hopefully one of my colleagues is going to share the slides in a second. Shall I continue, Chair? Is okay? Yeah. So yeah, so it's as I said, it's 14.9 million pounds overspend as of month 10. I'll go into a little bit more detail on some of the key areas that we have. So from an external placements monitoring point of view, there is a table which will hopefully come up shortly. So showing that the net expenditure for the year is 38.4 million. The two big overspends are residential placements. 5.1 million pounds, which is a forecast overspend to the end of March, and then unregistered placements, as they are very expensive. Again, a 4 million pound predicted overspend.
So breaking that down a little bit further, there are two graphs which are on the slides, which no, not quite yet. So I'll read it out anyway. So there are two graphs showing that the budgeted average residential placements are 77 for 23-24. We're actually at a level at the end of January of 89. There is a considerable amount of work going on behind the scenes to reduce those levels down to the budgeted level of 77, and that might be picked up shortly. The average weekly cost for residential placements has fluctuated throughout the year. The budgeted amount is the weekly amount is 6,113, although the current level is around £6,500 a week, which is above that level. And we are seeing increased pressure within the market. Hence, you can see there why the residential placements budget is predicted to be over towards the end of March. Are we looking? No, not yet. Okay, so the going on to the unregulated placements, which is obviously the second element of the large overspend. There is a graph which shows the correlation between the unregulated placements being reduced to a level of 1, and then the number of Homes and Horizons cases moving up to 10. So we're taking the children looked after out of the unregulated placements and put them in our own homes, in Homes and Horizons. Clearly, that has a positive effect. A very positive effect on the children, as well as reducing the actual cost as well. So there's a good correlation. So it's quite a good graph, which you will see. But it is in the pack, and it's definitely worth looking at. So I wanted to highlight that to members. From a fieldwork spend, which is basically assistance to families, mainly through court orders, there's some. You can see the reduction in costs. We're getting there. So reduction in costs, as you see throughout the year, which was up per month from over £350,000 per month on fieldwork spend. It's now down to a level which is under 100,000. And there is a graph on the right hand side to show the 3 key companies that we use within the fieldwork area and the reduction in spend that we are with those companies. At the DSG slide currently shows a dedicated schools grant. I won't go into too much detail because there is a presentation by Amelia and Joe shortly on the deficit management plan around the overspend in the dedicated schools grant area. But the forecast deficit as of the end of January is 15.6 million, with a cumulative deficit of about 37.5 million. But Amelia will pick that up in the next presentation. And then finally, we've got the SEN transport showing a big overspend again. So it's about 23.8 million against a budget of 22.4. There is some positive news though, due to being creative and selling some of the seats that we have on our buses that we use to other children. That's produced a favourable variance of about 300,000 from the previous month. So that's good news. So there's a whistle-stop tour of where we are with children's services. Happy with the directors and myself to pick up any questions.
Okay, so I'll start with an apology. There are for our technical issues. So that's you'll be pleased to know that's some of the reason why I'm diligent about asking for the slides to be shared beforehand, so that should the technical issues happen, I will apologise, members, for where we are. I'm conscious. So Francis has got her hand up. So Francis first. So thank you.
As ever, thank you very much, Heather. I've got 3 questions. Well, one of them is a comment. Absolutely appreciate the huge size of the overspend and the difficulties about the residential placements. However, when you look at the slides, it looks as though the number of placements is more than double what we budgeted for. That isn't true. It's because the graph starts at 70 and 77 is where what was budgeted.
Slide you're on.
Sorry, this is page 58, and it just makes it difficult. You have to pay you have to be really careful to understand the visual there actually tells you the wrong thing. So that's just a comment on how we look at data in a way that I'm afraid helps members to know where we are. The next one is not, I think, a question for you, but is one I want the answer for. Homes and Horizons is about not giving up on children, about making sure that they are absolutely stable. We've gone down by one. If it's because it's a success, that's great. If it's not because it's a success, I would like to know more about it, but that's clearly not a question for finance. And just a curious thing, the Sen Transport, which is it's one of the wicked issues forever. You gave us the budget as 22.4, which is what I added up to, but it's down as 23. Why do we have different figures like that? That is page 62.
I think first of all,
Have we
if
got
it helps, you could,
slides?
if it helps, you could probably drop the slides now, and then we'll.
These are the
it's
ones.
the-
These are the ones on ModGov.
Yeah, and I know we're working off market, so that one, the reason I'm saying that we're having trouble paying catch up. So drop the slides on the screen, but we can make reference to them
Yeah.
in what we're talking about. That'll make it a little bit easier. Everyone has access to the slides, which is the point I was making. So, Chris, do you want to come back?
Yeah, quickly, I suppose. Yeah, the budget data on the residential placements. Yeah, the budget data on the residential placements, we show the average of what we budget for the year. Obviously, it will fluctuate up and down. That's the budget which was set correctly at that time, but whether Claire may want to contribute on this. And then we're showing obviously the levels per month as to how they fluctuate up and down against the average budget, which we're expecting during the year. I'm happy to present it in a different way if that helps. And we can obviously discuss how that works. Homes to Horizons, just quickly, actually, on the following slide, it's showing that the children looked after numbers have gone down in the unregulated placements down to 1, and the Homes to Horizons so it hasn't come down by 1, it's gone down to 1 from about 15. You'll probably see there in April.
On the slide on page 59.
Yeah, and then you'll see then that the Homes to Horizons has increased. Well, but the trend, yeah.
Separately about that one.
Okay, so
which is why it's not a question for you.
Just I understand that there are likely to be some technical questions that come out of this presentation. So rather than us all get confused and go backwards and forwards. So I think I get the point you're making, Francis, is the graph may not be as representative as it would appear.
That is the one.
However, there are multiple levels in relation to it. So rather than raising our voice and getting frustrated about it, what I was going to suggest was there will be some times where I would have to say, let's pause for a second and take this question outside of the meeting, because otherwise I'm conscious that there are 16 people online and 16 people in the room that are all trying to intervene in the question. So this may appear to be one of those instances where we take it out, and I will ask that we bring it back as an afternote onto our papers, so that the response, so you're able to clarify your expectations. Chris and the team are able to give you the answer that is necessary, and that then can be recorded in our papers. I see where you're coming from, Francis, and I think I get, but rather than go round in circles, what I might suggest in this instance, if you're happy to, that we just say, in relation to the slide on page 59 of the papers, if we could have, if Francis will have a conversation outside of the meeting with Chris, we can clarify what the expert, and we can then respond to that adequately.
That's very kind. I wasn't trying to complain about it. I was just talking about how it's perceived. And the other question, I was very clear, is not a question that finance can answer.
Okay. Did you want to? Heather, did you want? So I'm just conscious that the first question, the one question you were already happy to take outside of the meeting, have a written response to. And the second one, which is down to the detail, we'll clarify, make sure that point's clarified and respond to and recorded. Your microphone's not on, Francis, so the people online can't hear you. Yes.
If I may, just for clarity, the third question, which I wasn't looking at the supplement, I'm afraid I was looking at the agenda. The arithmetic has been changed on the supplement, so the third one falls away, which is wonderful.
Okay, thank you. So we'll take the two main points out and we'll still look for a response to clarify where we are. Okay, that's fine. And the one that needs a response, we'll take back. Chris, pause. Toby, thank you. Okay, thank you. John Hunt.
Okay, we're on. Yeah, just I was going to ask a very elongated question, which I won't. Just a very simple one then. What is the difference between unregistered and unregulated? I'm a little bit confused. I'm easily confused, but that has confused me completely.
I will leave that to one of the directors to explain exactly how that works.
I'm looking for a hand online from there you go. Claire, thank you.
Okay.
You can refer to the fact we have mentioned it about a number of times previously, but go.
That's fine. It is complicated. So unregulated is a placement for a child in care that does not need to be registered with Ofsted. That there are no longer any placements for children that don't need to be registered with Ofsted. 16 and 17-year-olds did not need to be in semi-independent support, did not need to be registered with Ofsted until this it came in November that Ofsted had to register them. So until that point, you could have unregulated provision perfectly legally with for 16 and 17-year-olds and semi-independence provision, but that's no longer the case. Unregistered is where a child is living in a situation where they are being cared for, and that provision should be registered with Ofsted as a children's home. Unfortunately, there are a small number of children, both with us and in most other local authorities in the country, whose needs are so complex that registered providers with Ofsted are not willing to offer those children a home. There are lots of reasons for that. Some of it is that they don't feel that that child will match with the other children who are living there and could put themselves or other children at risk. Some of it is to do with Ofsted. Their Ofsted registration is obviously their livelihood, and if Ofsted feel that they're caring for a child who's too complex in a registered setting, Ofsted can grade them inadequate or end their registration so they can no longer run their business. And it's also when you have very complex children, it's quite difficult to recruit and to retain staff, because those children cause their distress can cause other people distress, and they can be quite physically aggressive. And obviously the providers who are registered with Ofsted need the staff in order to run their business. If they don't have enough staff, they can't run a children's home because there are particular ratios of staffing. So at the point of this report, we only had one child who's in unregistered provision. We try to move those children really quickly because it's usually not good quality care. It's usually through a nursing agency, which is very high cost, and can be up to £20,000 to £30,000 a week. Because they can charge basically what they want to charge on the basis that nobody else is willing to care for that child. So part of the reason for developing Homes and Horizons Homes was because we recognised the increasing trend towards complex children not being able to have a registered home, and we wanted to make sure that our children had a registered home that was properly regulated by Ofsted with high quality staff, and we could provide high quality care.
Thank you, Claire.
Thank you, Claire. And members, then just to remind you of that, that generally the young people in that situation are the more complex, and it goes back to the conversation we had previously when we were talking about Homes and Horizons, where the providers that are able to pick and choose which young people they take in the more complex are having to go into something that we then have to put in place ourselves. And that's one of the positives with the Homes and Horizons. It's given us the ability to better manage those. John, are you happy with that? So Toby.
Thank you, Chair. I realise my question was probably more relevant to Claire than it was to Chris. And it's really about the fact that actually we're still talking about children here. And so we've got 89 children that we need to care for, but we're trying to hit 77 children placements. How do we keep doing this? I mean, how do we keep doing this without putting children at risk?
So we're talking about the residential placements on page 58 of your pack, I think.
Yes, do you want me to answer that, Lee? Would that be helpful?
Please.
Okay, so the 89 children are in registered residential care homes registered to Ofsted. Unfortunately, because we have an insufficiency of foster care placements where we would like most children to be living in a family and a foster care placement, when we don't have sufficient foster care placements, we have to look to residential care homes for children to live. So there are a number of children in residential care who do not need the support and resources of a residential care home. They need to be in a foster placement. So the desire to bring down the number of children in residential care is based on these children do not need to be in residential care, they should be in foster care. So we have a very extensive and intensive campaign for our own in-house foster carers who are increasing slowly. And we're also working with the independent fostering agencies to try and increase our access to the independent fostering agencies for suitable foster carers for our children.
Yes, thank you, Claire.
And I'll just make a couple of points. I think something that I've noticed around the way that we've been able to manage some of, so back at the beginning of the year when we started seeing some of these projected numbers, it looked a lot scarier. It's a scary place we're into, but the indication was very much up, and through a lot of hard work, I'm conscious that we've managed to level things off, and it doesn't always come over that well when you see texts, but the fact that the projection was upwards on a lot of those, and the fact that now we've leveled it off a little bit has to be acknowledged, I would suggest, to be a good thing. So that's, I'm speaking to Chris, but the wider world there, I'm suggesting it's a hard situation. You know, we've talked, we're coming towards the end of our financial year. We've talked about, you know, the wonderful work that Homes and Horizons have done. I've been careful to keep reiterating the fact that let's not pin all our hopes on that one just because it's going, but it is doing some amazing work for us. The work that's been done behind the scenes for home to school transport that is making our position, I hate to use the term a little bit better because an overspend to this level is always, but the fact that we've been concentrated on it and drilled down has to be, I would suggest, members that acknowledge as a good thing, because it's taken a lot of people a lot of hard work to not make our overspend as big as it could have possibly been as it was being projected earlier in the year. So if that's a positive, I would just like to say something in relation to that. I acknowledge the good work that the home to school transport and maybe a graph showing a year of the projected and then where we actually are in relation to that may show some of the good work that's enable us to identify some of the good work that's been done there. I know I've seen it behind, but it would be maybe helpful.
Yeah, certainly we can add that in. Yeah, any feedback on any of the graphs and the financial data we put into the presentations, yeah, gratefully received. So yeah, absolutely. I think putting the numbers against the figures is an excellent idea. I'll take that forward for the next presentation. Yeah, absolutely fine.
Members, thank you for your questions. And we've noted that Francis will bring a question outside, which we'll bring back as an after note. Okay, I'm just conscious we're moving on to still talking about money. DSG is the next one. So that's item 7 of our agenda closed. Thank you. And we move on to item 8 of our agenda, which is the DSG management plan. Members wanted to understand a little bit more about the designated school grant and the projected overspend and how we might manage that position. I'm just conscious, so we've got Amelia and Joe. So Amelia that's introducing it, and then okay.
Joe will kick off with the finance slides, and then I'll come in off the back of that, if that's okay, Lee.
Thank you. Once again, members, if you, as you get questions on the way through, it is one of the supplementary packs on your mod.gov, so you may need to jump to that. But and I see the slides on the screen, so that's brilliant. So, Joe, thank you.
Okay, thank you very much. I'm Jo Curry. I'm the Finance Service Manager working with Education and Inclusion. I'm just going to cover some of the context and the background to the high needs block and to the deficit we've got at the moment. And then, as Amelia said, she'll come in with the detail on the deficit management plan itself. Oh, I can't see. I can only see what's in front of me, what's not what's behind me. Okay, so just some background. We have actually received an increase to our high needs block funding from the government for 2024-25, and that has gone up by approximately 4.4% from the current year. And that's obviously not in line with inflation, but it's better than nothing at all. Just some of the slides that Chris shared earlier, we have a current year projected overspend of 15.6 million, and that will take our DSG deficit at March 2024 to nearly 38 million pounds. And obviously, hopefully you all are aware that this is a bit of a national issue, although we're trying to steer away from the language around it being not our problem, and definitely something we need to do something about quite quickly. Just on the national picture, I think out of the 152 local authorities that receive DSG funding, 99 of those have got a deficit. And those deficits, I think, average of just over 15 million pounds at March 2023. So at March 23, we were at 20 million pounds. So we're actually slightly worse than the sort of national picture at that point. And we've mentioned this before. So there is at the moment a statutory override, which effectively allows us to keep our DSG deficit off the balance sheet. It is in our accounts, but it isn't shown effectively in our reserves position. If we had to bring that in, if that got cancelled at March 2026, then that would basically result in us having to issue a section 1.
Joe, just I'm conscious I'm shooting myself in the foot, but could you explain a little bit what a statutory override is for members, please?
I will try. I'll try. So, and this is something that the government allows us to do. It basically means that we don't record our DSG deficit as a creditor, as a commitment in our accounts. So it means that the 37.6 million is not taken into account when we look at our reserve position. So if we have to take that 37.6 million out of reserves, we're obviously in a much worse position than we already are. You know, hopefully that helps a bit. So that's that slide. Move on. Driving. So hopefully the next slide sets out the proposed budget for 2024-25, and this is at the moment the figures that are shown in our deficit management plan. So as you can see, the highest amount of expenditure goes on independent non-maintained schools. So we have just over 400 children in independent non-maintained schools, and those placements cost us a lot of money. I think the average cost at the moment is over £70,000 per annum for one of those placements. So that's a significant area of growth in expenditure terms. So overall in 2024-25, we're looking at projected expenditure of 96.6 million, which is a significant proportion more than the budget for the current year, over 15 million pounds more. The impact of that on our closing deficit will mean an additional 18.9 million on our deficit, which will take us to 57 million pounds deficit at the end of March 2025. Not an insignificant amount of money. Okay, move on. There's a slide just to show you some of the data on EHC plans, and this is the thing that really drives education healthcare plans. Sorry, too many acronyms. And this just gives you some ideas of the growth in the numbers of EHC plans over the last 5 years, and shows you the sort of expected trajectory in our deficit management plan. And we just put a statistic at the bottom just to say that over the last 3 years, the growth of EHC plans has been nearly 50%, and all those children have likely got some expenditure attached to them. So you can see this is a big impact on our on our high needs block. Okay, just got 2 more slides, hopefully. So this slide just sets out where we might be if we carry on as we are. And as you can see, the carry forward deficit projected in March 2030 is huge, £237 million. So we can't carry on as we are, obviously, otherwise we'll all be paying for that, I'm sure, not only in our council tax, in our taxes as we go forward. So we have come up with a deficit management plan. And the next slide shows you the impact of this. So we're looking at bringing that unmitigated deficit down by approximately £140 million. And obviously that's cost avoidance, but it's going to be a huge amount of work just to deliver that level of cost avoidance in the service. So at the moment, this is our current deficit management plan. It's still a work in progress, as I'm sure Amelia will cover in a minute. Okay, I'll hand over to Amelia if that's all right.
Thank you. So I think we can all agree that planning for £100 million deficit is not where we wish to be. But the reality is that the trajectory will take time for us to grip. And you can see that what we're aiming to do is to see that taper off and reach a point where we are bearing down as much as we can on that in-year deficit, so that deficit does not continue to grow. That is going to take an absolutely enormous amount of work from all our colleagues within the council and from our wider group of education professionals across the system. It will only be deliverable if we all pull together. But there is no alternative. The unmitigated position and even the mitigated position are obviously of acute concern, and we must pull out all the stops to see a different position. Next slide, if you wouldn't mind. What is within our control to enable us to bear down on cost is set out on that slide, and it's really important. This is one of the key outcomes from this work that we've been doing, and some of our colleagues have worked very hard. That mitigated position sits on very, very detailed workings, looking at the costs of individual children already in the system, support for individual children, and the trajectories looking at individual year groups and how many plans have been coming through the system over recent years. If we want to see a different position, there are not an infinite number of things that we can do. We can focus on the areas you can see on the slide. And this is the focus of the plan. So we can take effective action to reduce need so that a plan can cease because it's no longer required, or a need can be met with less costly support. That the most critical thing for us to understand as a system is that meeting children's needs is the most important thing. Children who don't need additional support because their situation can be resolved, a crisis or an escalation can be stood down. And we heard a really compelling story earlier, didn't we, about a child who was in a critical situation where support came around them, and that girl Poppy was able to operate at and to achieve GCSEs, to go on and hopefully succeed throughout her life. So not all needs are lifelong needs. And we need to be clear about how we can stand down crises, and alongside that, bring them to, children to a place where their support is lesser or no longer required. We can avoid new plans by better support to children, families, schools and settings. And we know that plans are sometimes reached for because things that could have provided that support were not available. If we can make that support available, then there will be people in the system who don't reach for that plan because it's simply not required. We can put in place better contract management so that those plans that placements that are absolutely required, we don't see escalating cost because our negotiations are strong and we're working in that market effectively. And we can also make sure that where we are spending money, it is always the most cost-effective placement. And we are looking at instances across the piece. Our colleagues are raising these with us and we're discussing them and looking at them. We're saying that placement was not the most cost-effective arrangement. And that doesn't always mean, if you look at an arrangement that more money might not be required. But certainly if we're spending money and not getting the outcomes, we need to get value from every single pound. And next slide. There's some broad principles that underpin the DMP. One of them is about the design of the system. And some of the things have been coming through from some of the analysis that colleagues have done and working with the system to understand that there are some perverse financial incentives and some areas where we could strengthen our methodology. This can get quite technical, but actually it's the technical management of the system that will make a difference. If we have grip, if we have designed it efficiently, that will help us. And that is difficult work, but it does make a difference. One of the principles that we would want to look at when we look at those design issues is about universality. So if we look across all of our children and look at how we target our resources appropriately so that it is more consistent, that gives us a stronger basis to have conversations with people when things get difficult and people have different views, to say, we all have come at it from a different angle, but this is how we do things here. This is the policy that we approach, that we utilize, and this is how we do it in this situation as well. And that provides the means to control costs as well, and quite importantly, to get better outcomes. And then there are two other things that again speak to each other, and I think this is a strong principle set out by the council, that decision making on the ground is most often better decision making. And we've tested with schools and we've tested with leaders there and with parents. There is an appetite to increase the visibility of the money that we're spending. When people know where the pounds and pence are going, quite often they can see the opportunity to do that better, but they can't do that. We can't release that initiative and those ideas if people don't know what the money's being spent on. So if in an appropriate way we can share where the money is going now, we think we can release some of that potential for better decision making. But in order to do that kind of work, we need to be coming from a place of consensus. Conflict costs money. And if we can talk to each other better, if we can come around the table in key plan, and colleagues have put a lot of time into thinking about how we do that, and there's some really good evidence coming through the system about how we can work together that's been put in place through the various SEND transformation projects up till now. If we can build a consensus of those foundations, then that helps us to achieve that goal and to use devolved decision making more effectively. Next slide. We've shared the plan. I don't know if you've had a chance to look at it. It is extremely detailed. Just trying to summarize the headlines here. I'm very happy to take questions about any of the detail, but the headlines are as you see them. So we're talking about consensus. Trusting relationships are really critical. And we at the moment in time, we have a backlog of requests for education, health and care plans. We know that sometimes plans are delayed because they are difficult. And if we can focus on the relationship building around those difficult cases, that will help us in the space around cost. Readiness for school is really important. We know that sometimes colleagues will reach for a plan because a child is approaching formal education. If we have more capacity on the ground to work in that transition to reception, hopefully that will leave parents, families and children and settings feeling more confident that that transition will be well managed. Mainstream capacity is a really significant issue. Now, when you saw the charts that Joe shared, you may not have picked this out, but in your papers, you will see that the amount of money that is going into the independent sector compared to the number of children is very skewed. Now, there's sometimes a reason for that because some of the children have higher needs who are going into that sector. But for the volume of children in mainstream, the money is proportionately much, much lower. And it's very difficult for us to shift that balance. But we are looking at the opportunities to work more effectively across organizations to build the capacity of our local mainstream schools to keep their children. A transition out of Key Stage 4, that's a transition out of secondary school, is an opportunity. So focusing on what are we trying to get to in that child's life? What does success look like? And looking at the potential for things like a supported internship agency, and the statistics around the success we've had around supported internships are really impressive. Our specialist capacity, our colleagues have been working for some time in conjunction with the Department for Education around Hillview, which is nearing completion. And there are other strands in that space around building those special school places in the state sector. And then the final three, so the first five all have costings next to them, and there are detailed numbers in the plan next to them. The other three are enablers. So about looking at our structures and our governance, that's about bringing us all together and using our resources in the most effective way. Looking at our consistency of our practices. Do we have clear policies, decision-making tools, and standards that we use across the piece? And then looking at localities. So where are our resources and how close can we get them to schools and settings to support the other strands above? Next slide, please. I think it goes without saying we're all familiar with the financial situation. And there are other pressures such as reductions in historic commitments that we are currently looking at around parent and family support advisors, which we've discussed in the past. There are pressures from numerous directions, but it also creates opportunity. And the extent of the challenge means that there is appetite for far-reaching reform where that is needed. And what I can say, sitting in this seat, is that the openness of colleagues to be innovative, to go further, to go faster, to really look at any corner for things that we could improve is really impressive at this moment in time. Next slide. Finally, and again, just coming back to that point about trust, about consensus, about all coming around the table to look at the design of the system. We need all stakeholders positively engaged, and Education for Life projects through the course of the last year has been identifying some priority areas for change. So we will be working after Easter, putting these design principles, putting these ideas on the table, working with stakeholders around things like structures, funding, processes, governance, that we have some things that are working really effectively, but we do still have some gaps. So we want to put that all on the table and say, now is the opportunity to ask what a high-performing system needs to look like for the length of this plan, and to put those things in place with everyone around the table agreeing that that is our best chance of tackling the challenge that we see here financially, but also in terms of outcomes for children. I'll stop there. I'm really happy to take any questions.
Thank you. I'll just make a note of who's putting their hand up for a second. Just while I'm taking the names, could you just clarify for me, Amelia? So an education, health and care plan involves three elements that feed into it. So obviously with different bodies having different responsibilities for the budget. Where does the designated school grant sit in relation to that? Is it an education thing or is it a council element?
So the dedicated schools grant, it's around £400 million, and it's what pays for education in the county. So it comes into us in the local authority, and we still have some local discretion about the distribution of that, but that discretion narrows every year, and there has been a policy for many years that we would passport the national funding formula from the local authority into schools. So that's the big picture of the dedicated schools grant. We make the policy decisions and then we disperse that. The money goes back from the county for academies into the Education and Skills Funding Agency, and then it's dispersed to academies. We disperse it to LA Maintained Schools. We retain the high needs pot, and we disperse the early years block to early years settings. So we are essentially the administrator for the dedicated schools grant. It sits in the council bank account. So that deficit is a council deficit in our bank account. But as Joe has described, there is an override that we can ignore that deficit for the time being. But it is local money. It is sitting in the council bank account, and we are paying it out to enable education to take place in the county.
Thank you, Amelia. Okay, first question from Martin, Councillor Lovell.
Thank you, Chair, and thank you, Amelia. Education for me is that the idea of an EHCP not necessarily being a good thing and possibly not being the answer. So that's where I want to come in on. Certainly have some casework immediately about EHCP, which I'm holding at arm's length at the moment because I can see it's going to be a bit of a minefield. I suppose it's useful for me, Amelia, to understand any approach which is dealing with, sorry, I'm using spectrum a lot today, but the spectrum from an EHCP to another solution, which was obviously more cost effective. What is the best way of approaching, or the best person to talk to approach as to whether what might be the answer to a particularly individual situation, whether be it EHCP or be it more involvement in schools? A bit of help, a bit of a steer and help for me, if that's possible. Thank you, Chair.
So if you want to drop me an email after this, I'm really happy to pick up in individual cases, because that would be on a case-by-case basis depending on the nature of the issue. But I think what you are alluding to is one of the things that we want to be discussing after Easter, is how do we make it very simple and clear about how issues around individual children are resolved, where the support comes from, and who do you talk to? And I think that's one of the lessons that we have learned through some of the work that teams have been doing over the past year or so, is that simplicity is paramount, because the world is very, very busy on the ground, and there are a lot of children in this county. We need to have a degree of understanding across the system about how we do things here and how we can very, very quickly, and we heard earlier from Nick at Young Somerset, how speed is of the essence, particularly when there is a crisis in a child's life or some unfolding scenario in a school or setting. So that's one of the things that we need to be looking at as a system is, does everyone know who leaps into action when the wheels are coming off the bus? And I think that's one of the areas of feedback that we have had, is that you can get escalation of cost as well as distress in individual, professional or personal lives if we're not fast enough, and if things aren't simple enough to be able to leap into action and get a response into place. Not everything always needs to be quick, but we can see the cost that escalates in the system when we're not quick enough.
Thank you, Chair.
Thank you. Marcus, Councillor Kravis.
Thank you, Chair. It's only my second meeting, so excuse me if I'd like to almost say, could you say it all again? But maybe I'll pick it up with Heather, some more of the details, or even yourself offline. But two terms that I didn't quite understand, I suppose, there was two supportive internships, I think you said, and then the other one was, what is education for life? I'd love to know a bit more about that one, what the actual definition means when it's for life. But also, you said appetite for far-reaching reforms because of the financial crisis, and how confident are we well, I presume we have to be confident that these far-reaching reforms don't reduce, I don't know, what's the word I'm looking for? Not ability, outcomes, but how confident are we that these far-reaching reforms will actually still carry on and provide the service that we're trying to achieve?
Those are all excellent questions. Let me take them in turn. So a supported internship, and I'll declare my past ignorance. It was something I had vaguely heard of, but I hadn't fully understood. A supported internship is an arrangement between a local business and a local education provider. It's like an apprenticeship, but it has more support around it. And it is proving to be a really, really effective way for children who might otherwise, as they're coming out of their education, find it huge barriers to getting into the world of work. That a supported internship includes mentoring, and someone who helps them make that transition into the workplace. And we have new internships coming online all the time with local businesses, and Somerset businesses have been stellar in their support for this. There is a window of opportunity when children are young enough, but we have seen for children whose life chances might otherwise have been in the balance, getting their foot into that employment opportunity that then is setting them up for long-term employability. So I'd be very, very happy to come back to Scrutiny and say more and give people a real flavour for what that supported internship looks like, because I think sometimes we need that lived experience from what that looks like for some of our young people, and some of those case studies, a sense of which employers. Feels like that would be something that would be very helpful to bring back to this committee if members were interested in doing so. But certainly the statistics about outcomes for children are extremely good at this moment in time. Education for Life is the strategy that we've been working with across early years schools and post-16 over the course of this year. And there's a great deal to be said more about the relationships and the work that has been done over the course of this year. We're now moving into years 2 to 5. And that's the work we will be doing after Easter to outline that 2 to 5 year strategy and what the transformation in that will entail in the education space. In relation, but your point about reform and our ability to deliver, I think is an absolutely critical one. We cannot risk any pause or any back step in terms of our ability to support school settings and children through a time of change. That is a non-negotiable. The quality and impact of our work must not suffer. And so one of the things we'll be looking at from a management perspective is what can we stand down? What can we stop? That is a nice to have, so that we are focusing on the basics of good delivery, and any other capacity that we have for transformation is not detrimental to the impact on schools, settings, or families or children.
Thank you for the question, Marcus. Just for clarity, in a bit, we're going to be talking about Education for Life as one of the strands for the transformation program that we have. I'm just conscious of, I'm going to jump in with a couple of ones, and I try very hard not to get political when I'm sat in this particular chair. However, just a question. I'll ask you a yes or no question in the first instance, Amelia. What guidance are you getting from government at the moment in relation to DSG and how you could change or de-escalate it?
So we have a SEND advisor from the Department for Education. We also have a designated lead from the Department for Education Regions team. Our plan has gone to SIPFA, and I can't tell you what SIPFA stands for. It is a national finance organisation. We haven't had any feedback from that plan going to the board. We have had feedback that Somerset has, I think their view was that Somerset took this process very seriously and put a huge amount of effort into this planning activity. You can read into that what you will about what the national engagement has been with this planning exercise, but we are taking it very, very seriously.
Thank you. It's just that, forgive me for, I don't mean to put words into anyone's mouth, but the Leader of Council has made clear previously when we're talking about the current financial crisis that Somerset finds itself in, that the funding model for local government is broken and needs repair. I would suggest personally, this is my personal opinion, I'm not asking for anyone to comment, that when we end up with a situation where we have, you talk about potentially 99 out of 152 local authorities potentially being considerably overdrawn on their DSG, then perhaps the funding model for this is broken. And that's just a personal opinion. So I'm frustrated that we're not getting more guidance in relation to that. We should be trying to find a way forward. And I would hope that the government would come down and be more willing to engage with us to help us, both as a local authority nationally and locally. The fact that we're potentially looking at what was it, 200 and something odd £1 million deficit in a few years' time is scary, particularly because, and I'll get to my point now, my concern is always when we start having to look back over things, an EHCP in place for a young person is to make their life better and be able to learn. If we're starting to put pressure on people to wind back and save money at the earliest opportunity, there's always the potential for a young person's education to suffer because of that, and that would be the last thing that anyone on this committee would ever want. So what we need to be able to find is a way that we are diligent in our approach to managing the EHCP plans, but also aware of the potential impact that this might have. And that would be the thing that I would hope that would come back in this. You've rightly talked about, I'm waffling, but I'm summarising as well. You talked about the fact that you're going to move forward with this. I think it would be important that this comes back to the committee at an earliest opportunity. So I'm conscious that the next few months are going to be busy. So maybe with a conversation with you, maybe in 4 or 5 or 6 months' time, we might want to bring this back. And I think it may by then be prevalent for us to make it more of a substantive item so that we spend more time looking at it, because there are going to be they're bound to be negative impacts to this, and I want us to be able to be aware of where we are so that as a committee we're able to watch and be able to support the direction of travel where necessary, and also suggest that you perhaps that's the royal you, Amelia, not you in particular, may want to consider winding back on some of this. And it would also be interesting for me hearing how our partners are helping with that, because this is as I said before, these are 3 different financial bodies that are working to one outcome, which is the adequate and sufficient education of our young people.
So I would just want to absolutely reassure Lee that it is paramount importance that children's outcomes come first. There cannot be a scenario where children's outcomes are being neglected because of concern about cost, but we do still believe that there is improvement in the system and that there is more value to be got from the money that we have. Now, once we reach a position where we believe we are maximizing the value from the money that we have, and if at such a point we are still concerned about the trajectory around spend, that's a very different thing. But we are not yet at that point where we are maximizing the value of the money that we have. So there's more that can be done without compromising children's outcomes. I think everyone believes that. But I think what I would also say in terms of reporting to this committee, because of the point that a colleague helpfully just raised about capacity, when we're talking about education for life, when we're talking about children's transformation, and when we're talking about the DSG management plan, we're not talking about separate programs. We're talking about a single integrated program of change, because we cannot manage multiple programs. We can only manage one transformation. So the DSG has been deliberately designed to integrate our financial planning with the rest of the transformation plan.
Thank you. Joe wants to come in.
Yeah, I just wanted to update just in terms of the finances. There were 2 programs that Rob may want to also talk about, which impacted on the financial side. So we as Somerset are in the Delivering Better Value program, which gave us a small pot of funding that Rob was largely involved with, so I'll let him talk about that. But there is also a level above that, which is called the Safety Valve program, and that involved negotiation. I think about 35, maybe a bit higher number than that now. Local authorities are involved in that. That doesn't come without any sort of conditions. That might involve the local authority having to contribute an amount of money to the DSG deficit itself. So that's not something, and it's not something that I think we can go to the government and just ask to be part of. We have to be invited and then negotiate that. So, but that may be something that will come down the line.
So just to pick up on what Joe's said.
You just introduce yourself.
Oh, yeah, sorry. Rob Hart, Service Director for Inclusion. Just to pick up on what Joe said, yes, we were invited to be part of the Delivering Better Value for Send programme in summer 2022. That provided a £1 million grant to support some transformation activity, which has gone to fund various different projects, but in large part, or a significant amount, has gone to fund additional capacity to do the work that Amelia's been describing in terms of developing a much better understanding of our forecasting and trajectory of future need. So that is part of the support package. I think without making any political statements at all, as Joe highlighted on the slides earlier, the funding for the DSG high needs block has gone up by 4.4%, and local authorities have been told to forecast 3% increases in future years. The department is saying that they are increasing funding in line with inflation. As the slides show, what has happened within Somerset and has happened nationally, it has been, yes, there's been inflation, but there has also been an increase in demand. And so effectively, inflation is being funded, additional demand is not being funded. And that's part of where the pressure in the system comes from. What I wanted to pick up on, Chair, was one of the questions you asked about education, health and care and the different elements. So within an education healthcare plan, there are different sections, and there's a section F, which describes education provision, section G describes health provision, section H describes social care provision. The DSG and the high need block exists to fund the provision that is in section F, the education provision, not the social care provision and not the health provision. However, such is the guidance that most of the provision ends up in that section. For example, the guidance is that speech and language therapy, which is usually a health commission service, always ends up in section F, and so it's funded from that point of view. And the last thing I just wanted to mention to Councillor Lovell around the how to get support. I think one key thing to be aware of, and for all members to be aware of, is the council commissions a independent advice and support service, SENDIAS, and they are kind of commissioned by the council, but independent of support to children, young people and families around their rights, around everything to do with SEND. They can work with families, with schools, and can provide a really helpful service. And so that would be a good to explore.
Thank you for the clarification. Just a couple of quick points, and I'll wind this one up. So I think the idea of a more visible where the money is spent is a really good idea, because it would give people a more visual understanding of how that goes. So I look forward to seeing that when it comes back. I also need to say out loud that I think as a council, it's good that the DSG is now becoming more visible in our finance lines, because it was always in previous years hidden behind a number. It's not really where it's other people's money sort of thing, and the fact that it is becoming more visible now is also good. And I also welcome the fact that education lines are being more visible in our financial elements, so that we can it's a little bit clearer. So I think as a committee we would welcome that. What I will say is that again, we'll make a note to bring this back when officers and the committee feel it's better to do that. I think the world is the next financial year is going to be the be all and end all for a lot of different elements in this, and we would be better placed in a couple of months to look at it again to see when would be rather than me say come back in 6 months, it might be worth it to be 4 months, that sort of thing. So we'll take that outside of the meeting as well. I would say that thank you for the presentation. Thank you for bringing it to us. Hopefully that's a little bit more information for committee members and to be able to understand it a little bit more. I will say, and forgive me for putting probably words in, if any members are unsure of any of this, I think that the DSG is an important element that we need to become more aware of, both as councillors and this committee, to make sure. So I would ask, if you have any questions, please make sure you direct them to the appropriate person. If you're not sure who the appropriate person is, I'm saying that now for both members of the committee and those with us online, send it to me and we'll find a way to pass it across, because I think the more we're aware of it, the better. Amelia, I see your hand is up.
It was just an offer to committee members. We have sometimes offered dedicated training on specialist areas. And if committee members would be interested in a brief training session on all things to do with the DSG, we would be very happy to arrange.
Thank you. I'll ask Steph to make a note of that offer so that we can put it into the minutes, and then we'll pick that up. If you're coming quickly, John, please.
Yeah, thank you for the offer. Yeah, for me, yes, absolutely, that would be fantastic. But just a very, very brief question, and kind of irrelevant with the finances as they are now. But if we were to underspend, clearly we're overspending on it, but if we were to underspend on this dedicated schools grant, would it be right to assume the government would then allow us less money based on that underspend amount the following year, unlike when we're overspending, they're not actually putting the extra in? Thank you.
That'd be like a dream situation. But I mean, initially it would have to go towards paying off the deficit that we already have. So any underspends that we make just go towards the £20 million we have already negative sitting on in our accounts there. But I think that's very unlikely.
Just to add in, the formula for calculating the DSG is based on pupil factors to do with numbers and need and things like that. It's not based on historic spend. So underspending wouldn't mean getting less funding in future years, but it is an interesting scenario.
And I'll have a quick. I won't ask the cabinet member responsible for finance to come in, but if you listen to some of the things that Councillor Leishon has said previously with our financial position, it's because we have other people's money in our system. I think the turnover for the total turnover for Somerset councils next year was in the region of £1.4 billion. That's other people's money as well as everything. So, but the impact of the DSG on the potential for a Section 114 is there as well, because it's a consequential impact, but that's a separate conversation of finance after that. Members, thank you very much for that. Hopefully you've gained a lot from it. What I've done, as amazingly, is we have the ability for a 10-minute comfort break now before we bring the next item. So it is 7 minutes past. So if I look to start again at 15:15, that'll give you a little bit of catch up. So thank you, members. Okay, members, thank you very much for your time. I'm gonna plough on. It is 12:15, and I'm looking to we've still got a number of items to cover. The next item is elective home education. It's for transparency. It's a subject that I've had interest in for a number of years. We did a task of finish report on it some time ago, and it's something that's become more prevalent that we've been talking about bringing back. So it is brought back. We have Rob Hart and Julia Ridge who are presenting for us. The papers have been circulated. Again, as always, if we could save your questions to the end, but indicate as they come in so that I can keep the list going. So thank you. If you'd like to give your presentation.
Thank you very much, Chair. I just wanted to check that I just want to check the slides are on screen, and I can see that on the screen people can see my legs, or at least one of them. So the purpose of the item today is to really just give a bit of a introduction about elective home education and raise some awareness of it. I'm Rob Hart, I'm Service Director for Inclusion, and Julia Ridge, who's Head of Service for Vulnerable Learners. We're going to do a bit of a double act here and have pulled together some slides, recognising that whilst Chair, you've had a long-standing interest in it, this may be an area that is unfamiliar to some people and is worth having a bit of an understanding of. So elective home education is a interesting area where there is interesting legislation. The slide sets out here that there is a kind of legal basis, a right for parents to choose to provide education other than at schools. And if parents choose that, then councils have no ability to refuse that. However, local authorities do have duties to ensure that children access an appropriate education, which means that local authorities can intervene if it appears that parents are not providing a suitable education. But there is very little clear guidance on what an appropriate education is, and very limited powers around what councils can do to intervene in that space. And I suppose it's worth saying from the start that that's contentious because there are, people enter elective home education from very, very different perspectives, experiences and points of view. That for some, elective home education is a proactive and positive choice. It's attached to a kind of philosophical view of the world and child rearing, and some families will provide a brilliant, varied and exciting education for their children in that way. There are some families for whom elective home education is a more reactive choice out of necessity, because they feel that the education on offer isn't able to meet the needs of their child, and they may still provide a really good positive experience, but it may not be the one that they would choose in an ideal world. And then we also have families where the choice to educate other than at school is done, that is not in the best interests of children, and where we would have worries about whether their rights to a suitable education are being met. And so that's the space that we're operating in, and that's why it's quite difficult and contentious. I'm going to hand over to Julie, who's going to talk a little bit about what the council does and our approach and responsibilities in relation to EHE.
Lovely, thank you very much. So I'm Julia Ridge, or not. Hi, I'm Julia Ridge, and I am Head of Vulnerable Learners, and the electively home educated children are part of my responsibility. You'll have heard that we maintain a voluntary register. Interestingly, there is new guidance or legislation going through Parliament regarding to attendance, and we had hoped that it would be mandatory for all parents to register their children as electively home educated. That is not what will be happening. What is happening is we are mandated to report what we know, which is not the same. So that's disappointing, because it would be helpful, I think, for parents to have a responsibility to tell us. Most often our data systems now are quite good. So if they come across our services at any point, they come into our data systems. But if they had moved in from a different authority and hadn't been on their data systems, we wouldn't have them. So we will have them if they attended any nursery and had 30 hours free childcare. So that's something that some families do. We'll have them if they ever attended a Somerset school. They'll be on our records. So we do have a net of collecting that data, but it is, I cannot assure you that it is all children, because there is no legal responsibility for a parent to tell us. When we do know that a child is going to, or a family is choosing elective home education, they have to tell the local authority. We triage those families and the situation that we see in front of us, and we decide whether or not we are going to intervene. We do write to them and we welcome them to electively home educated, so that we can build a relationship and they know that we are there to ask questions of or help for. You may be interested, you'll recognise in a minute when you see the data, we have 1,871 children electively home educated. At the moment, this academic year, obviously halfway through, we have 114 actively worked cases where we would visit, phone, because we're concerned and we want to be knowing what's happening. 59 of those are already being closed because actually a suitable education is in place. And please don't think that electively home educated means that a child is shut in their bedroom or shut in their home. That often is not the case. There are many community groups, Facebook groups that bring families together that have shared opportunities for learning for their children. We have 55 cases still currently open. You'll see as well that if we are not comfortable in the end, we can do a school attendance order. It tends to be between 15 and 20 school attendance orders a year. In the main, most get pulled before they actually go to court. They get pulled either because the parents have then provided sufficient evidence that an education is taking place, or that they ask to go back to a mainstream school. Two issues there, just for information. Issue one is that there is no framework that allows us to check against what a good education looks like. We just have to take our judgments about the feel for what's happening for that family. And the second issue, which you might want to be aware of, is that when we try and get the children back into school, they're deemed hard to place children because their background is more complex often, and our schools are actually quite nervous about accepting them and what needs to go in place to support those children. So not always easy to put in place. You'll also see on the slide that we have additional responsibilities for children with SEND and an education, health and care plan, and that's annually reviewed with our colleagues, and no child can be taken off the role of a special needs school without our approval.
So we've got a couple of slides with some data which I thought it'd be useful to include. I mean, I think Julia just mentioned about children and young people with SEND, and you can see a donut graph which kind of breaks that down, that about 20% of our 24% of our children with who are electively home educated have a special educational need or disability. Across the county, a number of children in schools with SEND is about 17 to 18%, so it's slightly higher. You can see that the numbers of children increases as they get older. We have a very small number of children who are supported by children's social care who are electively home educated, and clearly we have a particular focus on those because we want to really ensure that they're safe and that the arrangements are appropriate for them, especially if families are struggling to meet their needs. The second slide shows a little bit about some of the trends. So top left, we've got the number of I know it says exclusions on the graph, but that is incorrect. It's the number of children who are electively home educated, the number of starts each year. And you can see that before the pandemic, numbers were starting to come down, and that was not something that was replicated elsewhere. Following the pandemic, there was a significant rise in the number of requests for elective home education, and we've seen that fall off a little bit, and we've seen that there were some families who experienced elective home education during the pandemic, found it very positive and sought to maintain it, and then some of those have returned back. There's also a breakdown of the schools that children have been to prior to becoming electively home educated, and you can see a graph, a map of the county. What we tend to find is, so Avanti Park School is by far and away the highest. That's an interesting case. That used to be before becoming an academy, was a Steiner school, which had a very particular educational philosophy, and that philosophy has changed markedly since it became an academy, and I think that has moved to a number of families leaving that school. For a lot of the other schools, it either tends to be a pattern of where there is one school in the town or area, and so a limited choice. So if families don't get on with the school that's available to them, they don't really have anywhere else to go. Or areas where we might have had schools go through particularly turbulent times in terms of negative Ofsted judgments, so on and so forth. I'm going to hand back to Julie, who's going to talk a little bit about the work that's gone in Frome. This links to, as I say, Avanti School, where there were previously high numbers, and how the community work is going on to support EHE.
Thank you. So Frome, as you know, has a local community network that focuses on education, and they also have a children's group that supports the local community network, which has schools and parents and etc. on there. As part of that, they've been able to create their own priorities, and one of their priorities is electively home educated, and that would make sense because we talked about Advanti, which was a Steiner school, failed Ofsted, and the regional commissioner brought in Advanti, and as Rob said, very different ethos, and people did move to Frome to receive the Steiner education. So it was not as simple as being able to say, go back into the national curriculum. And you also note that Frome College has got 38 children as well. That's 119 children in one relatively small community that are electively home educated. So I chose to add this because I think it's interesting where we can actually do something different in a community where that community has a special and different need or focus. And actually the requirements or the suggestions from the community are not that great. They would like the consultations that Frome Council and the local community network have to design them not just around school timetables, but also activities more broadly. They'd like information and signposting so that they can actually meet with Somerset support teams for their children, which also seems very fair. They'd like to benefit from more playful social opportunities for their families during the school day, and wanted to work more in partnership to enable the community groups to help them in doing that. They wanted to collect and share information about volunteering and work experience, especially post-16, and that links a little bit to the internships different programme, but the idea that actually pre-16 you're building young people into their future careers. They would like better and more timely SEND support for their children, and they recognise they're a long way away from some of the support for SEND that's available. And they would want to be included in the local community groups. So not a big ask actually, because they are fairly an independent group, but I think that idea that we recognise them, that we have communication with them, and we don't exclude electively home children from our consultations, I think is really powerful.
Just to wrap things up, there's a slide which talks a little bit about future directions, and Julia's mentioned a bit of this, that for a long time there have been discussions about changes in legislation and guidance, and things have been in the pipeline, and the government has consulted about proposals and then consulted again about revised proposals based on the consultation, then consulted again about them. There hasn't been an appetite for legislation in this area. It's something that the Association for Directors of Children's Services have campaigned heavily about, is the idea of having a mandatory register, because it does make it incredibly difficult to fulfil the council's duty to ensure that all children access appropriate education if that's not in place. As Julia mentioned, we have a good understanding where a child comes off a school role into elective home education, but if a child never goes on a school role in the first place, then we know an awful lot less about it. There is updated guidance, and the guidance is being tightened a little bit around what a suitable education is, which includes a greater focus on literacy and maths. So I've included what the guidance says, and the guidance is a bit stronger in terms of the support that families should receive. And you will understand that the Department for Education have got a huge focus on attendance currently, and they want to have a more consistent approach across local authorities around school attendance orders, which are the measure that we take if we feel that a child is not accessing appropriate education, where we then have a legal tool to enable them to access it. But a lot of that is based on guidance rather than legislation, and it doesn't actually give local authorities any tools. And then because it's guidance rather than legislation, it's not backed up with additional funding.
Thank you. Do you want to go jump back to slide 5, which is that's the one.
Yep.
It's just for some clarity. It does say exclusions on the side, but I think what you mean to say is those are the number of children per year choosing to go into elective home education, isn't it? Rather than the number of children in elective home education.
That is the number of starts.
Yes. So that's those that we're aware of that have left the school environment and gone into home education.
Yes, or have gone into a home education at reception, and we're aware, or at statutory school age, and we're aware of it.
Yeah, then that's fine. I'm just got to say we've got Evie first, and then some questions.
Yes, thank you very much. This is not really questions, but I recently visited an alternative provision. I'm going to be honest with you that the brutal, honest conversations with the youngsters there, some of them felt that their educational healthcare plans, we were lacking the care, and we were really focused on the educational side was one of the reasons they were there. But also what came across for me, and I took it really personally, was that a lot of them felt we didn't care now. So I would like to remind councillors that we've got those opportunities. We can show them. So it's not a dig at the officers or the professionals here, but to reach out, because we can make those connections with them. So please do so.
Thank you. We've got Toby next.
Hi. Any relationship with Ofsted?
So Ofsted don't have any role in regulating elective home education. Where there is a relationship or an intersection is around alternative provision, which is something Evie's just mentioned. So home education is sometimes an inaccurate description, because children aren't being educated at home. They may be accessing various different education provisions, but it is arranged by the home, and some of those are alternative provisions. Now, you can have unregistered alternative provisions provided and who don't get inspected by Ofsted, and to be unregistered, they cannot provide full-time education to more than 5 children, or to more than one child with an EHC plan, or one looked after child. And so where Ofsted come in is that they're very interested in knowing whether there are alternative providers who are operating as unregistered schools, and so they will visit those providers.
I think it's also fair to say that when the local authority is visited by Ofsted, not this meeting, but the previous one, they actually asked for a presentation on how we were managing elective home education. So whilst they don't have an oversight of the parents, they do have an oversight of us and how we
that would be a part of the inspection of local authority children's services rather than inspection.
And an important point to mention in this is that we're elective home, but children that we're aware of. There's always the example I give when I first started doing the task and finish group a few years ago. I met a young parent and whose child was being home educated, and we then, through conversation, it became apparent that there was more than one child in the house, and I found out that of her 4 children, only one had gone to school in the first instance. The rest were being home educated very well because they were involved. But to me, that was just one example. So there were 3 children that potentially the authority weren't aware of. that's why one of the reasons that I think the voluntary register is a waste of time and effort, because it's not, it needs to be mandatory, only because we need to be aware of these young people, because in theory they're lost young children. It doesn't, just to clarify, that doesn't negate our safeguarding responsibilities for them. Sometimes you get a phone call from a neighbour saying, do you know the X so and so, their children don't seem to be going to school, and it's a safeguarding visit. Then you become aware of them, and you find out that they are being educated well, because around the county of Somerset there are lots of small groups that provide group support for home education. But it's that lost children element that frustrates me. John Hunt.
Thank you, Chair. Yeah, I've just got a couple of points to make, so if I just make them all, and perhaps if you give me answers afterwards, that'd be great. In terms of, so if a child goes to school normally, the parents decide to take them out to go on holiday, they might get fined for doing so. If children are absent regularly from school, then obviously the parents are asked about that as well. Is there, I mean, I presume the answer to this is no, but presumably if you self-educate your child, you go on holiday when you feel like it and you do whatever you want. Okay, it's very vague, isn't it? Do we have, out of interest, and again, I'm assuming not, but I think we should have success rates in examinations for children educated from home, which I can imagine perhaps might be slightly higher than those going to normal schools, only because they're getting possibly 1-to-1 or 1-to-2 education. But more importantly than the education, from my opinion, would be the proof of socialisation and mixing with other children in their particular peer groups. So do we have any sort of figures on that, or any proof that this is going on in a home where there's home education going on? And the other thing is, can anybody, so if I took my children out, I mean, I don't, they're too old now, but if I took my children out of school, decide to home educate them, can I get ready access to the national curriculum?
Thank you. Some interesting things in there. So in terms of attendance and removal for holidays, so there's no powers around that. The guidance, or so elective home education, if parents arrange it, must be efficient, full-time and suitable, but none of those words are defined in terms of what they mean. But full-time certainly doesn't mean it needs to align with the school calendar, and I think for fairly obvious financial reasons, most families who are electively home educated would probably not align their things to the school calendar. In terms of success rates and academic outcomes, no, we don't have any data around how well children who are electively home educated do. I think it can be a very varied picture, because on the one hand, you're absolutely right in terms of children can benefit from much more intensive support, increased focus or whatever. On the other hand, what we do sometimes find is that the proposition of arranging elective home education for a 6-7-year-old is very different to a 15-year-old who's wanting to do GCSE physics or modern foreign languages or whatever, where for good reasons secondary schools employ specialist teachers. They don't have one teacher who can teach the whole of the curriculum, so anyone opting to do that themselves is setting themselves a big challenge. But that's partly where different groups can come in. And in terms of access to the national curriculum, I mean, the national curriculum as a kind of description is available online and can be accessed. There are all sorts of resources that families can access, but the national curriculum isn't an entitlement for electively home educated children in the way that it is for other children.
Francis, Councillor Nicholson.
Thank you, Mr. Chairman. Yes, I'm particularly interested in the Froome work and the community work, and because it seems to me that the relationship between the groups that are out there and us is absolutely key, and has at times in the past been antagonistic, which is never helpful. I wonder. Other parts of the world do things like saying, right, home educating is fine, but come in once a term and talk to the school about what you're doing, your local school, that sort of thing. So there are different ways of doing it. Is there something about potentials for flexi schooling? Is there something about different ways that schools can react with families and children that might be relevant?
Rob, I see that Amelia is waving a virtual hand, so that you might be able to come in if you wanted to bring Amelia in first.
Yeah,
and then you...
Sorry, I was actually responding, Lee, to the earlier question about access to the national curriculum. It's one of the things I've just put the link into the chat for anyone who is interested. But one of the benefits of the pandemic was the entirety of the national curriculum has been uploaded in recorded lessons and resources for free. That resource continues to be available to anyone.
Thank you.
Can I just add to Amelia's point, actually? Bridgewater College Academy run online. You can go into their curriculum and then online activities for students, and they've got their Get Ahead programme, which again would support the whole curriculum. So not only have we got a national offer, there's also a local offer.
Okay, thank you. So, Steph, if you could just record those just so we can get those into the minutes. Rob, if you want to respond.
Then just to pick up on the question about flexi schooling. So flexi schooling is an arrangement that can be put in place where a child might attend school 1 day a week, 2 days a week. So it'd be on the roll of the school, but the school would be responsible for their part of their education, and then the family and home are responsible for the other part of their education. I think it's an area where there is potential that can work for children, but I think it's also an area where a lot of the incentives in the system really don't support it. In terms of schools can be really nervous about accountability for outcomes if they're only teaching a child to a day or two a week, the issues around funding and things like that. So it's something that could work, but it's probably quite difficult to make work best.
Would it be something worth working on and seeing if there were willing partners, it would be something that we in Somerset would be interested in?
I'm not going to say anything stronger than it could be. I'm slightly there is a question around priorities, and part of what Amelia's talked about earlier is, what is nice to have as opposed to essential. And then the other thing, just from a kind of be specifically answering this question, as you're aware, I'm only with the council for another couple of weeks, so for me to commit to doing things further seems slightly unfair on other people.
And you've been saved because Amelia's put her hand up. Come in, Amelia.
Thank you. So one of the strands of the transformation programme, and I don't want to speak too soon, but one of the areas that we're looking at is something we've loosely describing as Mainstream Plus, and around transformation and the DSG management plan. The strengthening of our mainstream offer and our ability to support mainstream schools to respond to a wide range of needs is a very high priority. So I think the definition of what that would include is all to play for, and there are some ideas in that space. So I would say, Francis, that is the appropriate place for us to take that kind of conversation forward. I wouldn't want to make any commitments about what that might look like in detail, because that would preempt that work. But certainly a broader mainstream offer is something that we intend to look at.
Thank you. I've got two more, Marcus and Hilary, to some questions, but I'll just jump in with a quick one following on from that. So, Julia, what learning has come out of the Frome position that we can take across county, and to go back a little bit to the school's responsibility and the home's schooling responsibility. If a child is educated within the mainstream system, an amount of money is allocated for that. If someone educates at home, do they have access to the same money? So 2 questions there.
Thank you. So the learning from Frome is one, that there are community groups out there and they are working together and they want to work together with us, which is a positive way to be. Actually, they're not asking for the world either. You know, so let's not be cautious about working alongside them. They just want to be able to touch base as and when we can do. And I'll give you an example of where it's important actually. That's public health. Because in public health, a lot of inoculations and advice get given to children in the classroom and through schools. And if we don't have access to those children, or we don't know about them through elected home educated, then they miss there is an opportunity that they will miss their vaccinations, etc., which is why it's also important. So the learning from Frome is not that difficult actually. And then the second question you asked me, if only I could read my own writing. I know, if I can, that's all right, money allows. Yeah. So there is no funding for electively home educated. So of those, if you actually calculated what 1,871 children were, and that's not just money into the schools, but it's money into the council that would help our fixed overheads and our service delivery. It is actually quite a substantial amount of money that as a community, Somerset is not having access to.
Thank you. Marcus.
Yeah, thank you, Chair. Yeah, nice to know I'm not the only one who can't read his own handwriting, which is why I am now. Apologies, as I said, if I show my ignorance on this topic. But I suppose there's a couple of questions that sprung out. The mandatory one, I'd love to know the reasons the government is choosing to not make it mandatory and how much lobbying can be done by people who should be lobbying, or whether that's whether that ship has sailed. I think John touched on a point earlier with regard to actual achievements or qualifications, for want of a better word. And actually, have we got what evidence, what's the date on them going into higher education, people being who's homeschooled going to higher education, etc. And then I was a bit, and I think it was when Lee said about, I looked at that graph, which I've lost, 41 children in West Somerset, but actually it was 41 people in 1 year is what you're saying, which was quite shocking to me for an area that is actually, although geographically big, there's probably not that many people at school age, and that figure's probably, well, I'd love to see someone who's clever than me can work it out, but actually, how do we know how many of those it's a choice, or how many of them it's a necessity? As someone who, persuaded his partner wants to take a child out of West Somerset School halfway through GCSEs and stick them on a bus to Taunton every day. We were fortunate we could afford to do it. There'll be people out there who can't, and then being forced down a homeschooling route. And then there was another question there, and I think probably Amelia touched on that. But is there other indicators about an issue with education in a certain area, and is this a key issue? Don't know how we solve that problem apart from funding. And there was another one I put big asterisks against. No, I think I've managed to read my writing okay, and I think I've covered them all.
Okay, I'm happy to take all of those in turn. So in terms of the reasons why there isn't a mandatory register, I think there are two things. One is the government's appetite for implementing any legislative programme has seemed somewhat limited in recent years. And so this hasn't been prioritised for that reason. But there is also, and I started off by talking about this being a contentious space. There is a strong elective home education community for whom it is a philosophy and a lifestyle choice that is really around quite a libertarian philosophy of not wanting state involvement and in family life. And that's why they don't want their children to be educated within the state sector. And for the very same reasons, they would be resistant to the state telling them that they have to register for things and that there may be checks on things and things like that. And so so that is, you know, that is one voice. There is also a very strong voice, as I say, from the Association Directed Children Services that says, from a safeguarding perspective, this is really, really important. And sometimes that discussion makes things worse, because then those families who make the really positive choice about elective home education hear, oh, so you're saying that we're being unsafe now, and that's not what's happening, but that's part of it. In terms of academic outcomes, in terms of progress to university, no, we don't have that data. The description or the question in terms of how much is through choice or necessity is a really interesting one. I suppose another area that Ofsted do have an interest in this when it comes to school inspections is when they look at off-rolling. So Ofsted define off-rolling as taking a child off a school's roll when it is not in the best interest of the child. And in the past, there have been examples where families are encouraged to choose home education because that would be an alternative to either prosecution around attendance or exclusion or so on. And so Ofsted will routinely ask to see files of children who've been taken off the school's roll to become elective home educated to check that that's not the case. But that's that doesn't capture the whole span of necessity, because I think one of the things that I think links to the information Amelia was sharing earlier around the rise around SEND is, if you unpick all of that and look at the data, nationally, the number of children and young people identified as having SEND has grown. If you look at the number of children and young people identified as having learning disability or serious learning difficulties, that hasn't grown. Where we've seen the growth in recent years has been children with mental health difficulties and neurodiversity. And that's occurred in some set, and that's occurred nationally. That's where the growth in demand around EHCPs is. And I think that's also where you see some of the growth in terms of elective home education, where there are cohorts of children or growing numbers of children for whom it feels like schools aren't working for them. They're not forced out, but families feel that it's a necessity, if that makes sense.
Can I just add a couple of supplements to that? I think I also run a service called Somerset Works, looks at children who are at risk of becoming not in education, employment and training, and that service is open to our electively home educated children. So I could tell you how many of the children feel, or their families feel, that are at risk of not moving on to post-16 education, as a sort of hint of, and also to give you an assurance that we're working alongside those families. You also mentioned what do we know what other things are happening, possibly to get an alert for schools. And you may or may not know that since September, we've been running a much more area-based model for inclusion services. And we have area-based managers that come together on a Thursday to have a look at the schools in their area and what the challenges are, and collaboratively work around that. And we have a data set for the county, which has children, how many are in SEND, but the things that we keep on here to watch those sorts of early identification that people are not comfortable in their community school are attendance, because actually that's a symptom that you're not comfortable, suspensions, that's a symptom that you and that community are not working well. And obviously we have electively home educated on here as well. So we can begin to just triangulate the information that we're receiving for families and have some early warning, which we then feed into the working with colleagues in the education partnerships as well. And my last point to probably make is that whenever I've done work speaking to focus groups about electively home education, it's usually very positive, because they're the ones who are doing it successfully. And the ones that actually are not doing it successfully are not the ones who volunteer to come and be on a focus group. While we were doing this presentation, I was looking for research on qualifications. You won't be surprised to hear that those children who are electively home educated with parents who are have degrees do better than those who don't. But we ourselves don't have that sort of data.
And I'll add a quick one, just for the way that we interact with parents that are taking the young people out of school has changed previously. There was a time when it was just occurred and there was no. Now Somerset do question the rationale behind that, so that A, they can understand the details behind it, and B, that if there are any whispers in the ear, your child might be better off educated somewhere else, then we can identify that and deal with those issues as well. So that's something that's there. Hilary, I've got you as the last one, so please welcome to the meeting and thank you for asking the question.
Thank you, Chair. Thanks for the invite to the meeting today. It's just really about exams for home educated students. So our schools, if a student wants to self-fund to do their GCSE, our school's obligated to allow them to take the exam in their nearest school, for example. And the other one, in terms of funding, you said that there is no funding for home educated students. Is there any potential for examinations to be funded, not the rest of their education, but just the examinations? Could they be funded in the future?
So there is, in terms of exams, there is no obligation for a child to be able to sit exams at their local school. There are various schools, all schools are registered exam centres, colleges are exam centres. So families can make arrangements with different exam centres to sit exams. There is no funding for exams, and one of the things we try to do when we're working with families in advance or when they're making decisions around home education is being really clear about what people are signing up for, and people are signing up for delivering the curriculum and funding your exams and all of that. So there are no so as things currently stand, there is no source that would provide funding for that. I mean, if someone decided to fund that, they could do, but that would obviously be a political decision.
Thank you. Just a quick one. Joe, your camera's on if you would just wanted to let you know. Okay. Thank you, members. Thank you for that. I just to summarise, obviously, one of the things that I fully support the need for a mandatory register. I think the committee would go there, and to partly answer the Marcus's question, I would suggest that the homeschool lobby are a little bit stronger in that instance than the directors of children's services, which is an interesting perspective to have. There's always a big lobby as to why interfere in what we're doing, sort of thing. I shared in the chat a report that went to Parliament, which does back in December of last year, 2023, which has got some interesting details in it. So if any of the members want something to read, one they could nod off. We talked about the curriculum and how to access that, the learning from the Froome project, and funding for placements. I think we gave that a good run. I know that if there are any questions, hopefully for some of you it's perked up an area of interest, because elective home education is a really interesting topic, particularly in Somerset. It was surprised to me when we first did the numbers that Somerset is one of the highest authorities with home education, home educated young people in the country. We were quite high on the list, and it took us. One of the first things that we did was that it's in there about where they are, because we expected a couple of big hotspots, but you can see that they're spread all over the county. So it's an interesting thing there. Thank you for that. Maybe there'll be no need to bring it back, but we'll keep an eye on it and see what the members want. Okay, members, thank you. So we're moving on at 1300 hours to item 10 of our agenda, which is the an update on the a verbal update on the Education Standards Standing Panel. I think my vice chair is going to just quickly run through that for us. So Evie.
Like the word quickly there. Thank you. So for this, it's very, at the start, we looked at summary of performance data, thriving schools data snapshot, education for life strategy year 2 to 5. So a lot of it was very data driven. So I'm going to try and bring this into some kind of like understandable narrative. So we started off with a summary of performance data. What we were looking for here was good levels of development, of expected developments for the age groups. And bearing in mind that nationally, you can see some slight moving in the goalposts over time. Usually positive outcomes for the early years, whereas COVID, usually we saw positive outcomes for the early years, but COVID influences saw dips in 2022 and a bounce back in 23. It is worth noting for those children to start well in the early years, it's easier to maintain that progress line. We looked at different dimensions of early years with the 7 primaries of learning. We saw that we were strongest in literacy, doing well in maths, and not so strong in the physical development. Obviously, in the early years too, the writing areas of learning were goals for improvement with the writing. This was both nationally and locally, but children at this age are developing their fine motor skills and lack the dexterity. Critical characteristics or area of concerns with the correlation and gaps in achieving where poverty and deprivation were present. Year 1 did see the pandemic bounce back compared to other areas nationally, or did not see it, sorry, with a recent dip occurring in children with special educational needs and disabilities and long-standing gaps with disadvantaged pupils. The expected standards was up, particularly in maths, which has kept pace. The gaps between local and national is only Diddy. This is Amelia's words, not mine. I probably would have used teeny. Sorry. Humour in there. The gaps are parallel together with the national data, so you will see them moving together. Key stage 2, the tables show that this has not been a strong area for some years. The low outcomes here can affect children later outcomes, but on a positive note, our best writers in this stage are remarkably exceptional. Key stage 4 were brilliant in 2016. But currently we are not quite where we should be, but our tracking shows a gentle improvement recently. Briefly on secondary schools, we discussed vulnerable and disadvantaged pupils and saw a consistent trend in attainment progress. A councillor commented that having structures aren't the only things that make a difference and believes that good leadership and management excels educational outcomes. With a snapshot of the trusts across the county, the data was able to be looked at for the individual schools as well as the trust as a whole. We talked through and analysed 2 fantastic examples of Manor Court, Preston Primary Academy Trust. And finally, we looked at education for life strategies, year 2 to 5. At the launch, there were some great initial conversations, but a wary optimism. In this time, 3 steering groups emerged: Best Start in Life, Thriving Schools, and Great Futures. The introductory objectives were aimed at building genuine relationships to enable those open and frank conversations to tackle big, scary, complex issues in smaller groups. The Best Start in Life group members had early years shared commonalities and interests, where honest conversations around experiences nourished new considerations for the council. An example given, and bearing in mind these are only small groups, so the subjective and individual, was a fractured contacts with health visitors. The example outcome here was for practitioners to know who their health visitors were. So this is not necessarily a wider issue. The Best Start in Life group also worked in projects on exclusion and those children reaching crisis points having earlier interventions. This group found that there was power in connecting people without shelling out the pennies. Thriving Schools discuss assessing SEND, early years help, assessments, and making sure that everyone talked and worked together for the benefit of each individual child. Vulnerable children, once identified, should be closely monitored and helped until they thrive. Also discuss with children what children want and what they need is friendships and positive things to do. And enabling these can make happier children, and this investment will serve healthier outcomes. For Great Futures, we looked at better leadership plannings and engagement and how interaction between all is key. One of the visions is to care more for the system so that we can care more for the children. Looking at moving some, they were looking at moving some big principles in the bigger picture to have solid visions and directions so that everyone can have a more forward thinking together. Let's just summarize this. Its purpose is to review the data that relates to educational settings, to report to Scrutiny any strengths, trends, and area of concerns from our analysis and results, to engage with system leaders to seek intelligence and have effective systems. There are interactions improve educational outcomes, as we're hearing. And ongoing forward plans involves inviting MAT CEOs and other members to hear how they review the performance and maintain the standards set out in their trust. And I'm going to honestly say this is a fantastic group. Amelia has admitted that her hobbies involve looking at data. You can really see that. And others bring knowledge and drive. So thank you very much.
Thanks, Evie. Amelia, was there anything that you wanted to add to that?
No, I think Evie's captured the tenor of the conversation. I think the invitation has gone out to multi-academy trusts, and we've had some positive response already, haven't we, Evie? So I think we're looking forward to that onward engagement, and I think that's the power of this group to make those connections and to share understanding across system leaders. I think is a really welcome development.
Thank you. Just for clarity for the newer members of this committee, this is a subgroup of this committee. The idea being that one of the things that we identified last year was the fact that the education's detail that this committee is expected to look at is sometimes hard to capture in the meeting. So the idea is that the sub panel can look at these things and report back as Evie has done. So thank you, Evie, for your report back. That's really interesting. What I will say is that for the newer members, if there is any interest in the education sub, I'll make sure that the dates for that meeting is circulated so that you can make sure that you can dip in if you want to. You are able, one of the wonders of the hybrid meetings that we're becoming more adept at is that you can dip into meetings from home as well as everything else. Evie, just a couple of points. Was there any were there any topics or points that your initial meetings have identified that you might want us to look at Scrutiny?
It's still relatively new, so we're learning ourselves. There's an awful lot of data there, and I think we're becoming more comfortable before we start bringing in other people to sort of like confuse us a little bit. Yeah, but I think Amelia will correct me. The next meeting on the 25th of March, maybe, if I got that right, or is
that sounds right to me. Yes, I think so.
Okay, I'll make sure that's shared. So for those of us that so you talk about data, it's interesting. I haven't done a cell for the governors for a while. So being a governor of a school is a great way to understand the operations of your school, but also the data that sits behind it and the learning. So I would advise any members in the room or any members are present of the great value being a governor of a local school can bring, so that it would help us in you understanding the data that we have there going forward. Amelia, Evie, thank you, and Amelia, that's that item. So thank you. That's item 10 done. Item 11 out of our agenda is a report back for the transformation priorities. I've spoken earlier. I'm going to suggest that we consider having a maybe one or two item agenda for a meeting coming along where we look at the transformation priorities specifically to allow us to drill down to the 4 areas a little bit more, but they are important. And I'm pleased to say that previously some of our members willingly step forward to become a little bit more aware of the topic. I'm careful how I say that because I don't ask our members to be topic experts. It's just an extra set of eyes on the priorities so that we can bring them forward. And I'm just conscious that the opportunity now is it says to receive a verbal report back on those items. So I don't know if we got is there an order, Jamie, or because I just conscious that all we've got is the priority. So the education for life, is there anyone that wants to feedback anything on that one?
So I took that on, Lou.
Thanks, Jay.
I haven't got any slides and I'm not going to say very much. I was just desperately, Evie sending you an email saying, I think I've got something wrong, like to do with IT systems, because Evie's just done a really good job of just talking about the education for life strategy as it is. So very briefly, there are five priorities, and all of those priorities that were identified can be scrutinised using different data dashboards, which I think over time, at a really high level, we can see year on year how things are progressing, and also then to kind of think about, you know, we're in a time of absolute financial crisis, then to be able to see if the resource that's allocated is being used and having the impact that we would want it to do to have. I did go to the year one celebration event, and thank you to Amelia for being able to put her hands on the slides for that very quickly for me yesterday, because I couldn't for the life of them find me on my system. During year one, of the Education for Life strategy, there was a real focus on building strong foundations so that the whole system is able to work and move together in the right direction. So there was some work done around Best Start. That's under 2-year-olds. It's interesting to hear what Evie says. Initially, there was a lot of conversation about kind of steering and finding out. There's been a lot of time kind of finding out what is going on. Some of the stuff for 2-year-olds is not yet in place, but there are some good shoots. In terms of things like every nursery knows who their linked home visitor are. Home visitor is, sorry, and also some work to find out, you know, kind of what parents are saying they might need and want for early help, and actually that helps to develop an understanding so that resource can be targeted, and I certainly know that work's been going on because of my role with Schools Forum. The early years advisory group are very keen to have their voices heard within that group. The Thriving Schools strand is a lot of relationship development, particularly looking at the local authority, you know, and what schools have said is that actually having access to local authority officers and being able to talk to them is a really good place to start. The MAT leaders, as you say, are engaging, and especially around attendance, and have also, you know, school attendance and improving school attendance, and then, you know, supporting school leaders in terms of having focused conversation and certainly conference around attendance in schools. A big priority across Somerset is the prevention of exclusion, and I'm certainly looking forward to hearing a little bit more about that. There has been some project work done, you know, kind of indicated has been really successful, but I'm not sure, and I couldn't put my hand on my heart and say because I haven't seen any recently, but I'm not sure yet how that is impacting on our exclusion figures. But year one is on schedule. There was a lot of, you know, kind of let's build better relationships so that we can work together as part of that. The Great Futures Group, I had some questions around that. It's terrible, isn't it? I'm not going to ask them now, particularly around what we call Ronnie and Ronnie resources. And those are young people who may end up not being in education, employment or training post 16. And I was interested in whether those resources have been rolled into schools or just sat in colleges, because that group is being chaired by the head of Yeovil College. But it is on schedule.
and is forward looking in terms of the support for post-16 pupils. There is also SEND strategy, and as Evie spoke about the governance around that, I'm not going to revisit that. So I'm quite looking forward to being able to feed back to folks, and actually as year 2 progresses around this, to then look in making sure that we are ensuring that the resource that is allocated is having the impact that we would want it to see. The only thing I wondered, and I probably should have asked Amelia's permission before doing it right now, is that there are 2 slides in the hello. There's 2 slides in what you sent me yesterday that have got feedback from stakeholders just on how things are going, and I thought that might be quite useful. They're not big detailed things, but am I right to share those? Yeah, they've got like little clouds on them, and it's where we kind of filled in the stakeholder feedback. Is that all right? Thank you.
Absolutely.
Should have asked yesterday. It's nice to see you. Okay, so thank you, and thank you for the opportunity to be able to feedback.
So thank you. That's amazing feedback. If you'd share them with Fiona, the slides, and she can share them a bit further out.
Absolutely.
Thank you for that. That's an amazing feedback. The CLA transformation. Anyone like to? Martin, thank you.
Right, as Children Looked After Outcomes Transformation Programme progress update. Can I remind you of the background? We are talking about the number of children who are being placed out of county, the number of children in unregistered and unregulated homes, and the children who, with companies where ultimately their aims are enriching themselves and their shareholders, possibly at council taxpayers' expense, which is all 3 contribute to our budget deficit. So the overarching aim of the programme was to increase the number of homes for children, especially foster care, and to reduce costs so that we are within budget against that fairly hefty background. So if we talk about what's going well, we have the agreement from the Department for Education for Therapeutic Education Services as part of the Homes and Horizons service. We have a foster carer recruitment campaign, creating high level of interest for new carers. There's a mobilisation of a new 16+ service and transition planning underway, which has already reduced the number of high cost supported accommodation placements from 45 down to 36. There's a purchase order pilot for external placements, which is successful. Further phased rollout is agreed, and will lead to better intelligence with respect to financial planning purposes. A sufficiency strategy has been published and shared with all providers, and this so far has been received well. So what's on the cards next? We've placing an order for annexes and pods within the Homes and Horizons service. Homes and Horizons Home 6 has become operational. Hooray! Implement Mockingbird model for in-house fostering service to offer direct foster carers to improve stability. To firm up property and staffing configurations for new 16+ service, and identify young people for safe and planned move on and young people to move into the service. To manage an annual price review process for all external providers, placement providers, and prepare for a launch of 16+ dynamic purchase system to provide the mechanism to secure additional beds 16 to 25 years old. So that is what I've done so far, Chair. Thank you.
Thank you for that update. Excellent. Moving on to the SEND strategy. Simon or Francis, have you got anything for us? No. Microphone.
Guess as much of a feedback from me. I'm sorry, I absolutely rely upon the lead member to make sure I can do this.
Mic monitor.
No problem. Thank you. No, as I say, I welcome the feedback. It's more a matter of just being able to update people.
Absolutely. You're not going to get a huge update from me, other than that. Absolutely, as has been echoed everywhere, the question of working together, and particularly working together with schools is the absolute focus of it, and enhancing the learning provision, the new ELPs and potentially SLPs, as a way of working to support SEND children in mainstream schools, to encourage that more and more and more. alongside the can the GFE please open its new school as soon as possible, please, and not be any later than it is, etc.
Thank you very much. Thank you, Francis. And finally, the fourth strand is to connect Somerset. Toby, did you have something?
Yeah, I've got some. It wasn't entirely altruistic, me jumping on this one, as it's about networking and connecting across Somerset. So incredibly useful. And I, a bit like Francis, was expecting Ruth to be here to help me with this. We started with a really good time with Richard to actually go through exactly where they are and what's moving forward. And I'm really looking forward to opportunities to do that more. The aims are to help more residents help them earlier, support schools to be at the centre of their community and draw on other community resources, enable residents and their families to be resilient and connected to their community and integrate services and support closer to home, improve residents' lives, reduce inequality, reduce demand for expensive acute services. So they're working hard at all of that. And there's an awful lot that really is going well at the moment, particularly the team around schools, development and go live of the transform team around the school, local engagement, and getting education partners on board. The universal early help offer, an automated early help offer with various community offers in different areas. Comms has been particularly, that was one of the ones that I was interested in, and really how we are getting this information out to people, particularly to schools. But 20 to 30,000 professionals have been contacted, developing comms and stakeholders list for that, particularly around blogs and social media campaigns and weekly comms articles wherever they can. Shared case management tools, investment in communities, building neighbourhood teams. They're already beginning to evaluate the impact of that as well, particularly commitment with ICB colleagues to collaborate to evaluate impact of early help. And workforce development, particularly with the 12 champions around the county to really help support that information getting out there and to support those early needs. What's next? Continued comms work for the Help for All, hashtag Help for All, children and young people's plans. Engaging with schools, continuing to work on that and building the neighbourhood teams, their champions and managers, relationship managers, inclusion and relationship managers. Evidence base for early help impact. Shared case management and help to help yourself. One of the things I really did ask Richard for was, I think, as we've heard today already, it's the stories that helped us picture exactly how this is working or whether it's working or not. So Richard kindly offered a little bit of a case study. So this week, a family intervention worker shares how a single mother was helped back on her feet by Connect Somerset. The family intervention service referred me to a single mum who needed support after fleeing domestic abuse. It's particularly timely as the Minster has just held the Soles of Our Shoes exhibition, which is about raising awareness for domestic abuse and just how much there is out there in the world that we just aren't aware of. But the mum and baby were socially isolated, so visits from myself and a social worker would often be the only human interaction the mum had. I gradually encouraged mum to rebuild her confidence, which included visits to the local library and the bank together to apply for available funding, referrals for additional support through the Job Centre and Christians Against Poverty, attending a local well-being event unaccompanied, which included speaking to a work coach, and securing a part-time job and thriving in the new role. The whole journey of support has taken just over a year and was combined effort from just some of the amazing support networks available for free in Somerset.
Excellent, thank you.
Richard, I hope I did you justice.
Thank you for that. And members, thank you for the feedback. I think it's fantastic, the fact that the detail that you've been able to provide, and hopefully the satisfaction you're gaining from there. And I really do appreciate it. And I think, as I said earlier, the suggestion will be that we bring the whole package back into to scrutiny at some point in the near future, just so we can look. Because one of the things that we're looking for both positive outcomes, but also areas of concern that we can drill down in and see, and by adding a bit of volume to it through this committee. So members, thank you very much for your feedback. I really do appreciate it, and thank you for that. Are there any points or questions that anyone would like to make in relation to this? Okay, so item 12 then, members, is just for me to refer to the items for information, just for clarification for those members, the new members to the committee. What we try to do, if there are any items that are for information, that we circulate them between meetings, so that if there are any questions that come from them, now is your opportunity to ask those questions or bring that forward. The Newton report was circulated, and some additional detail around the action plan for the short rate provision was circulated as well. Any points, questions, John?
TYC. Thank you, Chair, in brackets. I just want to talk about acronyms very briefly. We every single meeting, this one very much higher than all the others, but every single meeting has got an acronym issue, all these things that come out, and everybody's saying, what's that mean? What's that? Look at spending time looking it up. And we've suggested this ever since I've been at this council, I think, over both quadrenniums, quintrienniums we're in, aren't we now? But if I could suggest perhaps just an index at the top of a slideshow, just to show what each acronym stands for. And it would only have to be done once at the top. And when you read them down, for us, absolutely important, but even more important for those residents looking in from outside who think, what does that mean? So I think it'd be very helpful.
No, I take that on board. We have circulated a glossary before, and it's we did say that we were going to include that as a shortcut at the start of each of the points. So we'll do that. But one of the problems, the link to the glossary perhaps would be the one that we can now that we're electronic, that would be a better option, because if we start breaking down the acronyms, we will end up with a list of longer acronyms, a page longer than the report in some cases. But I'll make sure that we'll note that about the glossary. No, absolutely. And also I do try. I'm just conscious of when the vice chair and myself have our pre-meetings, we do tend to remind officers that they need to assume that there are members in the room that don't understand it, and that's why and that's why you see me jump in now and again with acronyms to remind officers of that. So it's very easy for people to they get used to the acronym rather than what it actually means. So point noted, John. Thank you. There being no further business, meeting closed at 1:30. Thank you very much for your time.